Okay, great. So, welcome, students. I appreciate you signing in, and we are going to start our 349 lab. Um, Professor Nuttycombe and I are here, and Professor Grover is here. Um, let's see, are any of our other professors here? Jesse, I don't see. Um, Okay, so we'll be facilitating this as a large group activity with all of you, and then we have a specific activity that I'll explain in a little while that you will do independently. Okay, so let me share my PowerPoint with you. First of all, can I get a couple thumbs up? Is the volume okay? Yes, okay. Some a little rules about, oh, I love that. Love the thumbs up. Some of the rules about engagement today is that lab is interactive and that we want to hear from you. If something is not clear to you, you need me to go over it again, or you have a curious follow-up question. Um, Professor Nuttycombe is going to be keeping an eye on our chat today. So go ahead and put something in the chat. If it's something she can answer specifically, she will in the chat, or if it's something that would be better talked collectively out loud with the group, is free to interrupt and say, oh, let's just take a point here and let's review something. Um, just a little bit of background. I taught lab during COVID, and we did every single skill online. And the ones we're going to practice today are the easiest ones to teach online. So don't feel at all at a disadvantage. We're going to practice them here, and then you can come to Open Lab, or we may refresh you next week when you come in. Okay? A student did ask a question about Thursday labs. I think campus will reopen tomorrow. I'm not sure. I think the problem they were having is with the snow removal in the parking lots. And I think that's why we're not there today. Not to mention it's probably, I think it's 4 degrees out, which is crazy.
So,
Or did it warm up, Jesse? Do we have
good
a
morning,
warmer
Professor.
temperature now?
Good morning, Professor. I just have a question that this lab is only for the Wednesday students, right?
It is for the Wednesday students. I'm not at all, if you want to listen in, you certainly can, but if you are a Thursday student, you don't have to be here.
Okay,
Okie
thank you.
doke. Uh-huh.
Thanks.
Yeah, my pleasure. All right, so let's get started. Okay, everyone see the PowerPoint? Yeah? Couple thumbs up? Yes. Okay, great. All right, so today we're going to be discussing how to take a complete health history. And I know all of you in your lifetime, if you've ever been to a doctor and doing an intake on an annual physical, have been on the receiving end of a health history. So whenever you're trying to remember things, start recalling things that have happened to you in your own practice or in your own lives. And it really helps ground why we do the things we do. So when you're thinking about a health history, if you've ever gone to the doctor about a specific complaint, you notice the questions are less. They surround your diagnosis and your chief complaint. But if you're going for an annual physical, they ask you a whole review of systems questions. So over the next 8 weeks, we're going to learn specific questions about body systems, but we're going to begin with those general questions about health history and background. Then we're going to keep going into asepsis. We're going to learn how to put sterile gloves on, open a sterile drape, and then we're going to learn about PPE. And at the end, we want to make sure that you're feeling very confident in how you take blood pressure and how to take vital signs. I want to let you know that if last week you had trouble hearing or things like that, sometimes it does take some time and repetitive practice, but I promise you we will get you there. The other thing we're going to introduce you to today is DocuCare. DocuCare is our electronic health record that is a simulated one that we use in the lab to help you learn how to use an electronic record. All right, so we always ground ourselves in the objectives for the day. I know you can read these, and I basically just told you what they were. So we're going to move through these pretty in a way that's comfortable for everyone's learning, and we'll see how it goes. All right, so we're going to spend a little bit of time on taking a health history. One of the things I suggest as an activity with you is that you take the time today to meet with a peer online or practice with someone in your home and ask them these health-related questions. One of the things, this is going to build on your ability to ask patients these questions in the hospital, as well as when you're demonstrating them on validations. And the more you do it, the more you're going to feel super comfortable when you come in to validate with your standardized patient because it's just going to be routine for you. We're going to do a DocuCare scavenger hunt. We're going to do that as a group activity because I want to make sure that you can move through a patient's chart and you understand where things should be documented and where you can find information about your patient. Then we're going to do the psychomotor skills. So if you don't have your skills bag near you right now, I'll take a pause. Everyone can have a little, go get a glass of water, what you need, and then you're going to watch me demonstrate sterile gloving, and I'll walk you through doing it yourself. We're going to do some PPE. Now you'll notice we're not going to do your hand washing skill check. I think a lot of you did that last week, and if for some reason they didn't get to it in your lab section, we will return to it when we see you back on campus. And then we'll practice vital signs. All right, so let's talk about a health history. Let's think about our own being on the receiving end of when you go to a provider and they're asking you these questions, a provider, a nurse practitioner, a nurse, what is some of the information that is gathered during that time? You can write it in the chat, or if you want to unmute yourself, I'd love to have a dialogue with you. So, when you're thinking of interviewing a patient, what type of information do you want to start with?
I think you'd start with biographical information, so like name, age, date of birth, that type of stuff.
Excellent, good. Because when you're thinking like a nurse and you start with name, date of birth, um, you start all already assessing that patient. The date of birth lets you know, well, maybe they're I have to think about what vaccines they are due for during because of their age. What is their age? What are some of the things that I need to be aware of? As you go through the curriculum here, we think about our patients all through their lifespan. So if it's a infant all the way to the oldest of the old, their name and date of birth starts you thinking like a nurse right from the beginning of like, what should I expect in this visit? So what's another thing that you need to do? Oops, sorry, I'm flipping ahead. After the biographical data, what else do you want to know?
We asked
Previous
about
health
like their
history.
allergies or any pain levels.
Excellent. So did I heard allergies? Are you having pain today? Excellent. So these are questions that we routinely go through in a systematic way. And the reason why nurses and doctors and healthcare providers ask questions in a routine, systematic way is because then you don't forget things. So typically that's the way we start. Um, Anybody else think of something else you would like to know?
Pat, there's a lot in the chat. I see present
Excellent.
concern,
Hmm.
allergies, medications, um, maybe ask vital signs,
Excellent. Good. You're all
past health
thinking
history, biographic.
excellent. So thank you, Jesse. It's hard I can't really see the chat, so just let me know. Excellent. All right, so let's move forward. So you're exactly right. This slide walks you through what you do in a healthcare visit. So I like the fact that you started with name and date of birth. And one of the things as you're looking at if the patient has a health record with you, it's your first step in patient safety is that you're going to identify your patient date of birth and then look in the chart to see if it matches, right? Because you don't want to be taking the history on the wrong patient. And then reasons for seeking care. What is an open-ended way that a nurse can say, seeking this question about reasons for seeking care to get the patient to kind of open up? How can you start that visit? I love that. How are you feeling today? What brings you in today? It's a great way to say in an open-ended way to get that patient starting to tell their priority for the visit. So it's never too early to start thinking about priorities as a nurse. Nurses have their priority. You need to get through their whole health history, but the patient, their priorities are different. They just want relief for whatever their chief complaint is. So that's when you start thinking about how to manage their priorities with your own. So yes, past history is absolutely essential. You're going to ask them about the history of their present health concerns, so more diving down into their symptoms, their family history. Now, why is family history? Why do we want to know that?
Because some diseases are genetically transmittable. So
Excellent. Sometimes they are that it is a genetic component, but also, especially in this season, it's flu season, is I always like to ask about, is anyone else sick at home? So asking about family history is not only the genetic component, but it is also the health in the environment. They may have had, they've been in recent contact with a child or an elder person or somebody who is sick at home, and that kind of lets you know, oh, they may have something that's, transmissible. Functional health assessment. What does that mean?
Does that mean like taking vitals?
Um, not specifically. Vital signs are part of the objective findings you find. One of the things is kind of going through, someone wrote ADLs and their functional health assessment, how do they move throughout the world? Do they have any trouble with doing their activities of daily living? And you do a health history as well. The other thing that we don't want to avoid is asking about psychosocial and lifestyle factors. Especially when you are new to interviewing a patient, they recognize just by virtue that you're in your uniform and that you've identified yourself as a healthcare professional, they expect you to ask some personal questions. So psychosocial factors can reside around things like, do you smoke? Do you use illicit drugs? Do you vape? Those kinds of questions. So when you think of adding those at the end, when you're having a collaborative discussion with them, they will expect you to ask some questions around there. You may also ask some things about mental health and do they seek care for any kind of mental health concerns. One of the things I want you to embrace is that when we're asking about anxiety and depression and other types of mental health concerns, that it should be leveled the same way we ask a question about hypertension and diabetes. I'm happy to say I think we're getting much better as a population that we dive down into mental health issues because we recognize they need to be addressed. And I think people are getting more comfortable asking, but it does take practice on your part. You may find some patients are willing to share and other patients feel a little off-putted by that. But if you have a neutral tone, it's so essential that we don't avoid asking those questions. All right, so now we're going to apply this. Okay, so
Sorry, Pat, can I interject really quick?
yeah, please.
Just when I'm assessing the like drug use and alcohol use and that like the social aspect of it, I just tell every patient every time I just have to ask these questions to everyone, and it's just so that I can take as best care of you as possible.
I love that. I think that's normalizing the discussion, and I love that. Thank you for putting that in, interjecting with that, because it is so important that we normalize the discussion to let the patient know if they feel a little hesitant to share. Sometimes patients don't want to talk about their vaping history or their mental health concerns or things like that because they're afraid you're going to judge. And using a neutral tone and saying, we ask this for about everyone so that we make sure that we have everything we need to know so we can treat you with your presenting symptoms or give you the best care we can. Excellent. I love that. Okay, so we're going to apply this now. And usually we break out in some groups, but because we're such a large group, I would love if you could put in the chat just A or B. But this is when you start thinking about different patients presenting. So let's talk about patient A. This is a patient who came through the emergency department with a blood pressure of 178/90. Immediately, what does your nurse brain say about that? Is that in the range of normal? Is it high? Is it low? What's your thoughts?
It's high.
It's high. Excellent. Okay. And the pulse is 76. High, low, expected.
Expected.
Seen a lot of normal and expected in the chat.
Excellent. Good. Thanks, Jesse. So, and this is a patient who has a history of hypertension, but they have known challenges of being able to afford their medication. She complains of being dizzy and feeling more tired lately. So this is you're confronted with these two patients, and I'm going to give you the next one. This is a patient who presents with the same blood pressure, 178/90, and their pulse is a little higher at 87. Is it still in the normal range, or is it too high, too low? What's your thoughts there?
Seen
Yep.
a lot of, yeah, you can see
Yep, I
normal
see
and
it.
range.
Yes. So normal, right. But there's no known history of hypertension. He seems a bit confused during the assessment, but is easily reoriented. So when you're thinking about these two patients, who is the one that you feel is the priority to see first? Let's see. So if you want to type in the chat what letter you think. Okay. Okay. So this is always a safe space to share your rationale for things. If someone chose patient A, would you like to share why you would like to choose this patient? You can always write it in the chat. Okay. See someone's So I see because she already has a known history of hypertension. So you felt like patient A with her known history and her inability to afford her medication would be the first one to see. Then I saw the rationale. Let me go back to the chat. Someone chose B because there is no history of hypertension and is more acute. And I would agree with B needs to be seen first. You can feel that patient A is a more a presentation that you're making the assumption that she missed her medication and that's what's going on. And it gives you a little more leeway and time with this particular patient. The other one, because they seem a little confused and this is a new finding for them, I would see patient B first. Okay. Are there any, is there any muddy points with that? Make sense? Okay. So over the next few weeks, you're going to be presented in lab with these different types of patients. We're going to give you a couple patients and you can discuss with colleagues and you'll make a decision and rationale for why you chose those things. One of the things this does is helps you to start picking apart questions. So we'll walk you through those way you do that. When we're presented with vital signs, we always bring you back, do the vital signs make sense with the clinical picture you're seeing? And then you're going to be practicing this. This correlates with when you take an exam in fundies or health assessment, you'll already feel very comfortable doing these types of questions because we're going to be practicing them regularly. Okay, so we're going to take a break from the PowerPoint and we're going to learn how to get into DocuCare, okay? So I think the easiest thing for me to do is stop sharing here. And let's take a second. What I'd like everyone to do is, I'm hoping this works while you guys are on Zoom through Blackboard, is I want you to go to getting started with Lippincott, and then you'll see DocuCare Enhanced. And I gotta minimize this. It's not letting me escape. Okay. All right. Can everyone see my Blackboard? Yes, excellent. All right, so let's go move down here. It says getting started with Lippincott. We're going to open that up. Ooh, okay. And it's this first block. Because of the way it shares on Zoom, can you see that it says Lippincott DocuCare Enhanced? Yeah, excellent. So Lippincott launches in a new window. If you are having any trouble launching this, it's usually because you're not on Google Chrome or you have too many things opened up in your browser or you need to clear your history. Okay, so first and foremost, we're going to make sure everybody's successful getting into DocuCare. All right, so I'm going to launch mine. And are you able to see the screen that says due in next 7 days? Yeah. Okay, thank you. All right,
No,
so
mine is
no, can't
blank.
see it.
Mine
Okay,
is
I got
blank.
all right, hold on a second. Let me start. I have to share again.
Yeah, I can't see anything
How
else.
about that?
No, it's not the screen. Like when we launch it, it's just blank. It's not showing anything.
Okay, can anyone launch it?
Yeah,
Yes, some,
yes.
all right. So if you are unsuccessful in launching, you have to go up to these three little setting things next to your face up here, if it looks the same as my screen, and you have to clear your browsing history and your cache. Once you do those two things, you will need to log back into Blackboard and it should allow you to see your DocuCare. So let's just pause and make sure everyone's on the same page with that. How are we doing? Better? Oh, okay, so Diana had got hers to work by canceling the other tabs. Will we have access? Hold on a second. What? Yeah, so Anna Maria, you asked about Zoom. I am recording this whole thing, so I'll send out the video link when we're done today. So to reinforce anything that I'm saying here. Excellent. Okay. Um, so how are we doing? Better? Okay. So today, when you launch DocuCare, your weekly documentation assignment will be found here. This week is unusual that you have two assignments. We will only be doing week 2 scavenger hunt. The other week 2 was that you were going to take vital signs on a peer and document them in a chart in lab. Obviously, we're not able to do that here. However, if you have a family member at home and you could take their vital signs, you can open and practice that. But for lab today, we're going to walk you through week 2 scavenger hunt. Okay, so go ahead and launch this. I'm going to switch mine to the student view. And Jesse, did it open to the right page or do I have to reshare it?
It looks good to me. Yeah. I see
Okay.
the main screen scavenger hunt. Mhm.
Okay. So let's try this in the chat. I'm going to stop sharing just for a second. I thought I'd take the Word document prompts, see if I can put it in the chat as to help them follow along. Okay. So I posted in the chat the things we're going to find in the DocuCare chart. Okay. So let me go back to sharing. Okay, hold on. I gotta fiddle with my screens. Close some things. Hmm. Okay. Try it again. I appreciate patient students. Okay, we're back in business. All right. So we opened up our patient's chart and let's just begin with the easy thing. What is our patient's name? Does someone want to unmute themselves and tell us what our patient's name is?
Tomás Esposito.
Excellent, good. All right, so you're going to find the patient's name up here. And with that patient's name, let's just find the other identifying feature, which would be
Date of
Date of
birth.
birth.
date of birth. Okay, so this is where nurses, when they enter a patient's room, they open up the chart and they identify, can you please tell me your name and date of birth? And they look into the chart to make sure they match. Now, if you're not in a hospital setting, say you're going to a community setting where there's no electronic record, but there is paper charting of some sort, you would use your paper chart with the patient's name and identify the name and date of birth. The next question I like to do, and I'm skipping over the primary diagnosis, is I always like to ask if the patient has allergies. My process as a nurse is name, date of birth. Can you verify if you have any allergies? I do that very early in our in identifying the patient because if I'm giving medications later or I'm preparing to talk to them about something, it's already in the back of my mind. So, does our patient have any allergies?
Yeah, penicillin.
Excellent. So our patient has an allergy to penicillin. When for that, I would always ask my patient a follow-up question concerning their allergies. Can you share what has happened to you when you've taken penicillin? Because you'll notice that patients will tell you, I have had an anaphylactic reaction to something, which is the most severe way to react to a medication. That means they had trouble breathing, their whole system was rebelling against the medication. Sometimes they have a sensitivity, which means they take an antibiotic and it gives them an upset stomach and they can't tolerate it. So I do like to make sure that I understand what they're referring to when they say allergies. All right. So, and why is our patient in the hospital? Anyone want to take a stab at it?
Is it the cellulitis?
Cellulitis. Okay. If this is a new word for you, notice there's a green stethoscope. I'm not going to open it right now because I think it's going to mess up your view. You can on your version, it links to your Lippincott nursing advisor and it will tell you what is cellulitis. When you're talking to your patient, you want to make sure you can read it in medical terms, but then explain it to your patient in layman's terms, right? Because they won't know all the medical jargon. But this is going to assist you all through DocuCare. When you start seeing unfamiliar words, an unfamiliar drug, use this little green stethoscope and it's going to help um, uh, give you future information that you'll be able to help the patient more because you'll understand what it is. All right, so, and then who is the admitting provider? Who's the physician in charge of this patient?
Tom Rankle.
Excellent, Tom Rankle. So he's up here, or if it's a nurse practitioner, whoever's listed there. Now we need to find a current medication. So you're not going to find the medication list up here. This is all really demographic data. You're going to find medications down here. There's two words saying orders, medication orders, and other orders, and MAR is medication administration record. So the orders that a physician or nurse practitioner orders are here. And you can see there's a lot of things ordered here. They are not all medications. Some things are labs, some things are care items, but I have a filter right here. So I can hit filter and I can just scroll down to hit medication orders only. And now look how short that list is now. How many medications is this person on?
3.
3. Okay. What are you going to do if you have no idea what any of this is?
Press the green stethoscope.
Excellent. You'll use the green stethoscope. So if you're listing one of it, the question says list one current medication. How many are current?
2.
2. Excellent. One has been discontinued. So this is not a current medication the patient is on. So make sure that you're not only looking at the med orders, you're looking at what is the status of the order. This one has been discontinued. Okay, excellent. Now, if you're looking for other discontinued orders, you can go ahead and scroll up here. It has all kinds of filters. So if you click this, you can see somebody had already done the wound culture, so that's discontinued. Someone did the blood culture, that's been done. Venipuncture means a phlebotomist came in and took blood on your patient, and this medication. All right, now it's asking us the next question in our list is how often should vital signs be obtained according to the provider's order? Okay, so I'm going to pause for a second and allow you to go into your DocuCare and find that answer for us. How do you find the answer for what is the order for how often vital signs can be taken? Anyone find it?
Mine says for timing it says routine, and I just went into active orders.
Excellent. Okay. So she chose active orders and it says the timing is routine, but it says a little more information here and then frequency is right here. What does this see when I scroll on this? What words pop up?
Every 4
See how
hours.
it says every 4 hours? So Q4H means every 4 hours. And over in the order it says vital signs every 4 hours. This is essential for the nurse to know because the expectation is you or a CNA will make sure that vital signs are taken every 4 hours, and very importantly, that you look at them and interpret them to know, does a provider need to be alerted because something's different that doesn't sound right, or are they following the trends of a patient? So you're absolutely right. Vital signs every 4 hours. And let's see. The next question is nursing diagnoses. Where do we find that? Nursing diagnoses are different than medical diagnosis. A medical diagnosis is something like cellulitis. Our patient is admitted with the medical condition of cellulitis. A nursing diagnosis describes the condition of the patient that you need to keep an eye on. So for someone who has cellulitis, which is, you know, they have inflammation in their extremities, let's say it's their lower leg. That is the medical diagnosis, but you as a nurse think, well, there's not a lot of good perfusion or flow to that leg. So I have to make sure that I'm keeping an eye on that. So you may say inadequate tissue perfusion as the nursing piece of that medical diagnosis. That means you understand the physiology of the medical diagnosis to know what nurses need to look at. So you're going to observe that extremity for warmth, circulation, fluid overload, those kinds of things. So that is the beginning steps of thinking, I know the diagnosis. What's the physiology that I need to attend to? And that's what a nursing diagnosis is. Where you can find them is right here under plan of care. And you can see, as I mentioned, because that patient has cellulitis, their nursing diagnosis is ineffective peripheral tissue perfusion. All right. These are something that you're going to start hearing a little bit more about. We're going to try to implement them in lab. We don't teach them as diligently as we used to. We've kind of gone away from it, but I tell you, as a nurse, this is the way I think. When I hear someone has a medical diagnosis, my nursing brain automatically goes, what is the physiology going in the body that I need to look out for? So that's where you can find them. You can also create your own. So you can, when you're in clinical, when you do your acute care clinical, when you think about the physiology of the patients you're seeing, you can click here and there'll be a list that you can choose of, like what's going on with my patient that I need to look for. All right, so now we are going to look at blood pressure trends or vital sign trends. Where do you think we go for that?
The section titled Vital Signs.
Excellent, right? So what you have to really pay attention to are these timestamps. Okay, so this is 2 days ago, and we're moving towards now. And what nurses do, and we'll talk about this when we do our virtual our VSIM day, when we do our in-person first sim, we're going to talk about what trends look like. But this is where we find them, and we start thinking about what do they mean for our particular patient. Okay. And if you practice today and say you take a blood pressure on a peer or someone in your home, if you wanted to document a new set of vital signs, you're going to click this blue button and it opens this up. So let's just do this together when you think back, last week you practiced vital signs. Can you remember a blood pressure that you heard or estimated in your patient? Or you can just give me any blood pressure. Professor Nuttycombe, do you have a blood pressure for me?
I do. Let's go with we can say 120/80 was the first response. We got a perfect blood pressure.
Okay, awesome. Okay, so we're going to put that in. Now, one of the things that's important as you're taking your blood pressures, we want to know the location. So this refers to cuff, left upper extremity. So if you took it in their left arm, cuff, blood pressure cuff, right upper extremity, and it goes all the way down. So Professor Nuttycombe, where did you take your blood pressure?
I'm not sure. Maybe if the moment I type something in the chat, or do you want me to just Dr.
Oh,
Schaefer?
you can just give it to me. I'll
All
just
right,
show them
let's
how
say
to
we took
chart.
it in the right upper extremity.
Okay, good. All right. And what was the heart rate?
We will say the heart rate was 76.
Okay. Now, breaths per minute.
Let's say 16.
Okay. Now, SpO2 is something that was in a slide deck. Recall your professors may have told you about something called a pulse oximeter. It's a non-invasive device that it goes on the end of a finger to let us know how saturated the blood is. As we're learning vital signs in lab, we're not going to be taking this vital signs. So that means I'm going to skip it. I'm just not going to put any data in there because I didn't take it. All right. So if I had taken it, you may have to put on here what kind of oxygen the patient was on. And if they weren't on any oxygen, it's just room air. Okay, but I'm not going to put a number in here because I did not take that. All right, so we're going to chart in Celsius. What was our temperature, Professor Nuttycombe?
Let's say 36.5.
Okay, and what does that correlate to in Fahrenheit? And why I'm asking is Professor Nuttycombe made nice charts for
I
us.
did. I don't
And
know if you
I
guys
have one
with
now.
Corey.
These are going to be in the lab.
Is 97.7.
Excellent. Okay. And is that a normal finding on this cold day where nobody can feel the circulation in their fingers and everybody's nose is cold? I think it's normal. Now,
Okay.
then it asked me route. How did we take the temperature? So what was the method that we took the temperature with? Oral means the mouth thermometer, rectal, obviously that's where you would take the temperature. Tympanic, what does that mean?
You got some ear.
Ear.
Someone said the ear. Mhm.
And temporal is the one that you go from the temple and move around, core and axillary. Okay, so we're using the thermometer we're using in the lab is the non-invasive thermometer that looks like this. We're going to call it temporal because we don't have a drawdown to describe it as the forehead. All right. Oops. We don't have a weight on our patient. We don't have a glucose level. I don't know when they last ate. So then the last thing I'm going to do is just hit save. And you can see if you scroll over, my vital signs that I charted now populate in my chart. Okay? It's as simple as that. All right, now we're going to move on to something called intake and output. When we're taking care of patients in the hospital, it's very important that we're keeping track of the volume of things going in and the volume of things coming out. When patients are in acute care settings, we're monitoring all their body functions to make sure that those things are making sense. If a patient isn't taking enough fluid. Sometimes you'll have patients who forget to drink water or their water pitcher is empty and you recognize that they're low on fluid. It can affect their vital signs. There's lots of reasons we keep track of this. So this INO in the left chart panel is the intake, what the patient took in fluids, and output is what anything that came out of the body. Okay. We're going to dive down this in activities in the lab over the semester, but I just wanted to let you know this is where you find those things. Okay, now our next question is, who's the last person to document a note in the chart? How do we find that?
Under notes?
Yeah, it is under notes. So then you're just going to go ahead and read this note on the bottom was written on January 26th. So going up, the most frequent or the newest note will be at the top. Okay. And our nurse's name is right here, is timestamped that this is the nurse who wrote the last note. If you need to read more of a note, you just click this open and you can see this is the beginning of how a narrative note. Over the semester, you're going to learn how to write a narrative note. But this is see how this is such an easy example of just organizing a patient's health history and physical exam. And you're going to learn how to do this. All right, and then let's go back to this next question. It said, has Mr. Esposito had a fever since his admission? So how do we find that out?
Go back to the vitals.
Yep. And tell me if you see that he was febrile any time in his admission.
Yes.
Yes, excellent, good. All right, anybody having any trouble navigating the chart? It's not too hard to do. You're going to learn how to document it. Feel free to practice by putting a set of vital signs in there because we want, this chart is for you to kind of find things and feel comfortable with. All right. Let me stop sharing a second. Yeah, go back to the PowerPoint, see where we are. Mhm. Okay, from current slide. All right, now we get to move a little bit, which is good. We're going to start with some sterile technique. Okay, so asepsis is broken down into two areas. We have medical asepsis, which is just making sure that you're doing good hand hygiene. You're wearing gloves where appropriate. You're keeping things clean. Follows standards precautions. It's the thing that we do for every patient when we enter a room. We recognize anything in the patient's room. When we touch it, we have to think about hand sanitizing because there could be pathogens on that. So you're going to see when I demonstrate doing sterile glove and sterile draping, I'm going to wipe down my surface before I start. Okay. Surgical asepsis is much more of a rigorous protocol, and it's for sterile procedures. There are times when nurses have to do sterile procedures in the acute care setting. So I'm going to teach you how to put sterile gloves on today, okay? Sterile gloving is a very precise practice that needs to be done with intention. You just don't whip them on. We're going to walk you through it step by step. It's very important that you adhere to the protocol of sterile gloving because pathogens who live on your sterile gloves can be transmitted to a patient's body, and there can be a bad outcome that happens because of that. So just think in your nurse brain when you're doing any kind of procedure, is it a clean procedure or is it a sterile procedure? So when I'm practicing with and talking, you're going to hear about me saying an area is clean and an area is sterile. So the protocol around sterile is much more precise and needs to be monitored very carefully. All right, so we're going to do, you can just unmute yourself and say the answer to this. You touch the sterile field. So a sterile field is, we're going to open up a sterile drape. And hopefully you were able to watch that in the video, and I'll demonstrate it in a minute. But I open up my sterile field and I touch it with my clean hands. Is it still sterile?
No.
No.
No, no. And if you're alone in a patient's room, the only one who knows who did that is you. So you have to hold yourself accountable. It is okay to start over. It's absolutely essential that you always say, you know what, I broke sterility, I got to start over, because there are adverse reactions to that. It happens to all of us. You accidentally touch something, go, oops, I got to start over. Your hand sanitizer drops from the sanitizer container onto your sterile gloves. So this is a hand sanitizer and it drops onto my sterile gloves. Is it still sterile?
No.
No. This outside is probably pretty grubby from people touching it, right? So no, it's not. I hold sterile gloves above my waist. Yes. Now, this is essential when you're working in a sterile field and have sterile gloves on. And the reason we want them waist high, as soon as they go below your waist, you can't see them. You don't know if you accidentally knocked your, perhaps you knocked your uniform, you knocked a bed, you hit the bedside stand, and if your glove hits it, you could break sterility. If they're above your waist, they're in your field of vision so that you won't break sterility. You reach over your sterile field during your procedure. Does that break sterile technique? I have my
Yes.
sterile glove, but I reach over. Yeah, I appreciate. Yes, it is breaking sterile technique. Because I have this sterile glove, my uniform is not sterile. Particles, anything can drop from my sleeve into my sterile field. So we don't do that either. So I'm set up my sterile field, and then Professor Nuttycombe walks into the lab and says, "Hey, Dr. Schaefer," and I turn around. Do I break sterile field? Yes. And what would I say then?
Just start over.
I'll just start all over again, right? It's not her fault. She didn't know what I was doing, and I just instinctively turned away from my sterile field. So this is what I mean about sterile fields. You have to be very intentional and think about what you're doing. All right, so we made this really easy for you. If you go through the PowerPoint later, it'll walk you through to make sure that you get your answers correct. All right, so this is our directions for the lab. I'm going to stop sharing again. Okay, and we're going to see how this goes. Does anybody, do you need like a 5-minute break just to stand up and stretch and get your sterile gloves? Okay, that's fine. It's 9:05. Do you want till like 5 after? Do you need a break? I know you had a long class yesterday and virtual learning's hard. So let's just take a break. You can go get some water and then I'll turn the screen back on at 10:05. Please have your sterile gloves near you, have your sterile drape. Try to clear a field in front of you to the best of your ability. I recognize there's some limitations. If you have like a bottle of hand sanitizer somewhere in your home, you can bring it over. Okay. So we'll start with the two items. Where are mine? Sterile gloves that were handed out to you and a sterile drape. And we'll just take a pause and I'll see you back at 10:05. Okay? Thank you, everyone. All right. So I'm going to give everyone a few minutes to join back. Oh, I got to unshare my background. So the background I chose is actually in our hospital, but in order for you to see me well, I think I should take it off. Mhm. Okay. All right. Let me see how to position myself. Mm. Just step back. Can't see my overbed table. Can you, Jesse?
No, I can't.
Okay. This
No.
computer isn't as okay. Let me think. Maybe I can take it off. Hold on a sec. Better?
Yes, that's good.
Okay. All right. Well, students, this cracks me up because during COVID, I purchased an overbed table that I taught with all during COVID for students, and who knew that it was going to come in handy again? Um, no expectation you will buy your own overbed table, but these are the things that you see in the lab rooms. And just a little about these. We want you to touch things in the lab. So you have to get used to adjusting tables for your height. I'm only 5'4". I'm working at a little higher level than I normally would just because I want you to see this well, but I want you to make sure you're touching these things so that when you go in the hospital setting, it's just one less thing you have to learn how to do. In the lab, we don't have you do this because of time and products, but if I was setting up a sterile drape, we're going to start with sterile drapes first because it's a little less psychomotor skills. So you're going to have your drape ready, okay? But if I was in the hospital setting up my my sterile, where I'm going to set up my sterile field, I would go ahead and wipe down my table. Okay. And can everyone hear me okay? Give me a thumb. Okay. Yeah. Okay.
Yes.
The other thing that you want to have available is a trash can, right? So one of the things that I do is I want you to practice this as well. I never touch a trash can. I try to use it like with my soccer skills, which are very minimal, but I use my foot to kind of move the trash can around because once you touch the trash can, you got to re-sanitize your hand and do all the things. So when I'm thinking I'm going to be setting up a sterile field, I want my overbed table, I want it cleaned off, I want a trash can ready because for those things, and I want hand sanitizer that is available for me. So my trash can is below your field of view. I drop it from waist height, my cleaning thing, and it went in the trash. Okay, so my field is clear. I'm going to go to my supply room and I'm going to pick up my sterile drape. One of the things I want you all to get in the habit of is reading packages, okay? So this one, it just says it's a sterile drape, sterile towel drape, okay? These come in different ways. The ones that are packaged in your kits are white on both sides. Now, if you are home right now and you don't have these products, just follow along with me. I promise you that I'll give you extra supplies when I see you physically next week. I'll make sure that you feel like I've touched it and a faculty has seen me touch it and feel comfortable. Okay, so just follow along. Now, is the outside of the package sterile? Nope. And did you see how I just touched my face? I have to use hand sanitizer. Okay, so the outside of the package is just clean, but I can go ahead and put it down. I'm going to use my hand sanitizer. Oh God, I haven't used that in a while and it just came out at a rapid speed. Okay, everyone looking at their clock. How many seconds am I doing my hand sanitizer?
20 seconds.
Excellent, thank you. Do you see how everything in lab repeats itself? Repeat, repeat, repeat. Every single thing you learn in lab builds, builds, builds. Okay, so my hands are clean, okay? Now I'm ready. What I want you to do is just watch me do it once, okay, all the way through, and then we'll walk you through you doing it yourself, okay? So I'm going to pick up my package. It says peel to open, which means it has two flaps that come down like this, okay? And then what I do is I just peel it apart with my hands. The adhesive on some of these packages are pretty tight and it may rip on you. Just do the best you can. See how it ripped down the center? Usually it peels apart nicely. Some of these sterile drapes are kind of old. My job is to get it down on the table like that. Okay, so you flip it away from yourself. All right, now, and then again with the trash can, I drop the package at waist height, goes into the trash. What if it floats like it just did across the floor? What do I do? Didn't hit the trash. What do you think?
You wait and leave
You
it.
can just leave it for
Yes, I love it. Victoria just said leave it. Yep, I'll just leave it. I'm alone in the room with the patient. It's fine. I'll get it before I leave. Okay. So, your sterile drape is I can touch it with my clean hands to rotate it. When you open up your drape, you're going to notice there's a closed end and then there's sort of a fluttery end on the other side. What that means is there's a little bit of an edge and that has to point away from you. So that means there's a closed fold nearest my body. And then up here, you can see it's the top of the drape and it looks a little fluttery. So think about flutter away, meaning it's away from your body. When you open it up, you have to look closely, but you should be able to see it. I'm keeping the principles of having my hands above my waist, and I won't turn my back on my sterile field, and I'm not going to reach across it. So if my edge was facing the wrong way, I can take my hand and just rotate it around. Now, the reason I can touch the outer edge here with my clean hand is because when I open it, this will be against the table, like laying on top of the table, that side. So it will no longer be sterile, it'll be clean. My edge is here, so I'm going to rotate it back. And then what I'm going to do is pinch the corner and open my drape. Okay, so when you open it this far, you're really going to see that fluttered edge away, okay? Now, I want to position the drape a little better center so I can move it like here because I know this edge is going to be against the table and no longer will be sterile. There is a 1-inch margin around the sterile drape that's considered clean, not sterile, because you have to be able to touch it somewhere. So we kind of keep in our mind that there's a 1-inch boundary around so that you can touch it with your clean hands and open it. Okay, so I'm going to pinch here and I'm going to open it. So if for some reason you pinch, it's kind of 2-ply. If you pinch too much of it, okay, see how it's opening? And I have to make sure I drape it like this. So what I'm cognizant about, what I'm thinking is the edge that I touched has to be against the table. Okay, I'm going to close it up and just show it again real quick. Okay, all right. So I'm going to pinch the edge. And you notice what's facing you is sterile. And then I drape it on my table. Okay. Now, it's a little bit of a, I don't know if you can tell, but there's a big hump in the center. It's not completely flat. I can't reach across the drape like that. I have to kind of pinch around the edges here and I just pull it flat like so. Okay. That's a sterile drape. So the principles, can I do this? Nope. Can I reach across? No. And what if I, I drop my hands down here? Excellent. Go ahead and answer someone has their hand raised. Go ahead and unmute yourself.
Oh, I wanted to ask, so is the essence behind not turning your back, is it in case you don't see somebody else touch the field, or what is that?
It could be it not necessarily a human. It could be anything that is um, anything that could fall on your field and you're not aware of it, right?
Mm,
So you really have to keep your eyes on your sterile field just to protect it. It's that sterile a procedure.
yeah,
Yeah,
thank you.
Sorry,
excellent question.
follow-up question. Uh,
Uh-huh.
so in reality, I mean, of course, we can't sneeze over it or close to it.
Uh-huh.
Can we talk this close? Like when you're not
Mm.
teaching, when you're not demonstrating, can you talk, or do you have to wear a mask to
That's
talk?
an excellent question. I appreciate it. There are some sterile procedures that you must wear a mask to complete them. You'll learn about dressing changes for certain type of vascular lines that we use, and you wear a mask for that reason. If you're doing a dressing change or something like that, as long as you don't have active symptoms of coughing or anything like that, you should be okay. But obviously, if that is a good question, if you feel like you need to sneeze, you're going to use your elbow to sneeze in, you're going to take your eyes off your sterile field. I'd probably start over.
Thank you.
Excellent question. Yeah. Any other questions? The other thing I want you to be aware of, some of our sterile drapes are blue on one side and white on the other. The blue side is down. It's because it has an extra pad or padding that makes it less likely for liquids to push through. So the blue side always is down. For your practice thing, though, these are white. So really you got to pay attention to that fluttering edge. Okay. Um, so the principles too are the inch margin is all considered clean, not sterile, but the center is sterile. Now, just for demonstration purposes, I'm going to show you how you would put something on the sterile field. It's just for you to know how we do it. It's not, we're not going to practice that today. Okay. So if I have something I'm going to place on my sterile field, it's the same principles. You're going to open what you want to put on it. You're going to flip it away from your body so it doesn't accidentally hit your uniform, and you're going to just place it on the field. If for some reason you flip it and it ends up in the inch margin, what do you do? What do you think? So instead of flipping it in the middle, I accidentally flip it, it's over there. What do you think I should do?
Get a new one.
Take a new one.
You know, you could get a new one, or in your nurse brain, you think, I'm not going to touch that. I'll leave it on my sterile field. It hasn't contaminated, but I need to be aware it's off the field. It's okay if you get a new one, or if you have an extra one that you can replace it with you, you can just go ahead and keep going, knowing you will not touch that again until the end when you clean up, right? So if I was going to remove it from my sterile field, it is okay to pinch it from the top and then just throw it away. Okay. All right, good.
Pat,
So,
I'm so sorry. Can I add one thing?
sure.
And I'm not sure if you said this before opening the sterile drape, but always make sure you check expiration dates for anything that you're using. And
Yes.
we'll practice that with medications and stuff too.
Yes, excellent. One of the things in the sim lab is we do have expired products from the hospital because we're trying to be cost effective. It's if you notice something's expired, you can say, you know, this expired 6 months ago. We will tell you, thank you for noticing, but please proceed. It's okay. But absolutely, nurses in the hospital setting have to make sure it's current. Are there anything in the chat that we need to attend to? Any of our other faculty have any tips they want to add?
I just had a quick question.
Sure.
If it has the date of manufacture, but I don't know that it has an expiration.
Date. Let's see. Yeah, this one does not. So you would do your best to see if there was one, but there isn't one here for you to really look at. So you would
Okay.
just say, I'm checking expiration dates. Yeah,
Thanks.
I'm going to,
I just real quick, Pat, I just want to interject and
Sure.
remind all the students to feel empowered to call someone out if they see sterile field being broken.
Yes,
Like that is 100% okay in the hospital
yes.
setting. People will appreciate it. Like it's a safety thing. So feel empowered to do so.
Absolutely. That is, it's imperative you do so because you can see from my, example of someone calls my name and I turn my back, it's okay to call people out. Please reinforce each other too. When you're practicing with other students, you're not being picky or picking on anyone. You're helping them in their practice. So we really do watch each other. If you watch me when I'm demonstrating something and you see that I touch my glasses with my sterile glove, call me out on it and say, you actually broke sterile technique because you touched your glasses. I'll be like, oh my gosh, thank you so much. And then I would move on. So excellent. Thank you. Faith, did you have a question?
Yeah, I have a question. So we
Yeah.
can't turn away from this sterile field. Where do we put the I don't know what to call it. Where do we put the stuff we have to put on the sterile field? Where do we put it so that we don't take our eyes off from it?
Yeah, so what I would do is if I was putting a bunch of sterile dressing things on my sterile field, I would take my sterile field and pinch it and pull it as far over here, like to the edge. And then I would have my clean packages all piled up here. And one by one, I would flip them into the center of my field and drop them into the wrappers into the trash. You'll notice the way I have this set up, it also, when my sterile field is ready and I have all my products on there, I still need to put sterile gloves on. So I like to move to the side and I could see my field, but I can open my sterile gloves and put them on here, right? And then I could move over and I'm good to go to start my whatever I'm doing with the patient. Excellent question. All right, how do we feel about practicing?
Hey Pat,
Yeah,
I just wanted to remind all the students it's really a good practice to make sure we have all the supplies we need before we start anything.
mm-hmm. I typically will put an extra pair of sterile gloves in my uniform pocket if I'm going in to do a sterile procedure because if I accidentally break sterility with my hands, I can hand sanitize and put on another pair of gloves. That's okay. And I agree, just put your packages, line them up, bring a few extras. You can always return those if you don't use them. Depends. Like if you can't always bring things back from the patient's room, but your clinical faculty will help you with that. All right. So I want to be able to, I'm really hoping we're on campus tomorrow, but if we're not, I need to repackage my drapes so I can show those students how to do it. One of the things I'm going to do is just notice the folds. It's no longer sterile because I'm just going to repackage it for practice. I'm going to follow the fold lines. And then I'm just going to go ahead and close it up and put it back in my package because I think we only sent you home with one drape and I'd like you to try it now and practice again with it, okay? Sterile drapes will pop up again later in the semester because we drape when we do an intermittent an in and out catheterization of a bladder. So these principles we'll return to them again. So I think it would be good if we could practice for one round to see if we can do that so you can ask any of your curious questions. We have a lot of faculty online right now, so we're here to answer your questions. If you want to share your camera, we'll see if we could figure this out. And if you don't have the products, just kind of follow along. Maybe watch another student do it if they're willing, and you can give them feedback in the chat personally. Say, I see that you did this or that or the other. So I'm just going to take a seat while we practice a little bit. Do you want me to demonstrate it like step by step while you open your packages? What's your thoughts? What would be best for you?
Yes, please.
Yes, please. Okay.
Let's start, please.
All right. So go ahead and, to the best of your ability, clear a space in front of your computer. Or if that's not possible, you can tilt your screen and step where you can kind of follow along. And is that good? My name's kind of in the way. All right. All right. I see people doing their hand hygiene. So my first step is to go to the supply closet. I'm going to pick out my sterile drape. I'm checking it for expiration dates. There's nothing listed. I'm assuming it's good to go. Okay. I'm going to put that on my overbed table that I had already cleaned off. And now I'm ready to open my package. So I'm going to take my hand sanitizer, sing happy birthday to myself 2 times, or just know that I need to do it for 20 seconds. And you know what else? Okay, so that's good. All right. All right. So now we're ready to open our sterile drape. Mine's been opened before, so if you're having struggle with it, just bear with us. So you pick it up and you see it says peel to open. So you're going to take your 2 thumbs like this and pull apart. Excellent. I see one opening very easily. That's great. And you're going to flip your drape onto your surface. And I'm going to drop this from my waist height into the trash. Okay. Good. So I'm ready to position my drape for opening. My drape's fluttering edge is towards my uniform, so I'm going to rotate it away. So you should be able to see a closed edge that's closest to your body, and then a fluttered edge on the other side that you know that when you pinch it, it'll open. Okay, so it'll be all closed edges towards my body, the opened edge fluttering away. Okay, now I have to proceed to opening it further. I'm going to pinch the 2-inch edge or an inch from the edge and flip it this way. And then I'm going to take it from this edge and flip it that way. Now I can see that fluttering edge much easier now. So hopefully you do as well. If for some reason you're like, oops, that edge is near me, not away from me, it's okay if you make sure not hitting your hand sanitizer to take your fingers and rotate it, okay? But if you're good to go and you see that fluttering edge farthest away from your body, you're ready to go. Okay, so then you're going to pinch the 2 edges here and here. And keeping in mind the side my hands are touching are the ones that need to go on the overbed table next to it. Drape it down. Okay. All right. I still have that bump in the center, so I'm going to come along the sides and just pinch it so it lies nice and flat. Okay. All right.
I had a question. My side has like a sticky part. Does that go? Do you know what I'm talking about?
Yeah, I can see it. So you're not really looking at that stitchy part, you're looking at the edges. And let me look in your camera if I can tell.
Or should I turn it around?
You should rotate it around. Yep. Yep. So because when you rotated it around, I don't know if you noticed, it went down in front of your uniform. So what I would have done is closed it up in half. So let's have you practice that again. Close it in half. Just flip it over. There you go. Excellent. Now go ahead and practice rotating it. You'll have to go 360 because you had it the right. See how that's better and you have more control? Yeah.
Mm-hmm.
Okay, good. Now you can pinch those edges. You're going to pick up those edges, pull it up, and then drape it down. Good. Feel good?
Mm-hmm.
Yeah. All right,
Thank
good.
you.
Hey, Pat,
Yeah.
we had a question about like what the fluttering edge was. I think it's just hard to
Sure.
see.
I'm going to close my drape and bring it really close to the computer to see
I was
if,
gonna see too. I took a picture of it on my phone and emailed it to myself. I'm gonna see if I can put it in the chat, maybe.
it is, so when you have your drape closed, you'll notice this is an open edge that I can pull it open here. That means that's the right edge away. If I try to open it with the closed edge, you can see how it won't open nice. So the fluttering edge, I'll bring it as close as I can. I don't know if it's
Your
going to show.
video is blurred, that's why it's not clear to see. So like your video is blurred, so it's
Oh,
hard,
my video's blurred.
so it's hard to see like the paper and everything.
Okay. All right. Let me see if is it a little clearer now?
Yeah, at least, yeah.
Okay, so my fluttered edge is down here. So look at the bottom edge. Can you see? This is all tight and is a tight edge and it doesn't have any laps, but this one isn't completely laying on top of each other.
So the fluttering edge is the side that can be opened.
Yes, so it needs to be away because when you pinch it, it pulls up the whole drape like this, okay? If I don't have that fluttering edge away and I try to open my drape, it's all messed up, right? See how it only opens 3/4 of the way? If you hold your drapes up to the camera, maybe we can tell you which is the fluttered edge. We can do it.
It's like
Let's see if I can tell.
edge.
Let's see if we could do it this way. We have time to practice in person briefly. Yeah. Okay.
And I put a picture of it in the chat. So if you look at that picture, the top edge is like very smooth and crisp and it looks clean. That's the folded edge. The bottom edge, like it's almost like you can see like the layers of it. Like it looks like a ruffle of what Dr. Schaefer was saying. I don't know if that picture is helpful. But the topmost edge is the folded, the bottom one is where you see the ruffles. It looks like uneven.
If you double click on the picture, it's way easier to see.
Ah.
Is that helpful?
Yeah. So see how this edge doesn't, it's like an envelope edge. See how it's tight? It's like an envelope that you can't open, the close end. But if you look down here, this edge, they're not lined up perfectly. That's what I mean by the flutter or the ripple.
Yeah, you can see like layers of the fat.
Yeah, there are layers of fat of tissue. Here it's so tight, there's no way you can open that end. You have to be on this side.
See, Diana has a question.
Oh yeah, go ahead, Diana.
So sorry, just to repeat. So the fluttering edge is towards you, and then
it's far away. So
the fluttering edge is away from you.
It's flutter away.
Flutter away. And then when you open it, you bring that part away from you or towards you?
You bring it straight up, right? So when you bring it, and then you lay it down.
In front?
So you have to think the side that your hands are touching needs to be the side that's down. because you've
Okay.
already contaminated it with your clean hands, and that comes down.
Towards you.
Yeah.
Okay. Thank you.
It really once because draping doesn't take very long, we will open a drape when you guys are all in lab next week, and everyone can come up and say that's the fluttering edge, okay? Because it really once you see it, you can't unsee it. You'll be like, I get it. Okay? I'm happy to look at edges though. I'm sorry about my blurry camera. It's not good. All right. Are you ready to move on to sterile gloves? Yeah?
Yeah.
All right, my friends, here we go. Mm. All right. So I went to the supply room and now I need to put my sterile gloves on. I'm going to look at my package and read, these are nitrile examination gloves. I recognize there's one student in the lab that identified to have a latex allergy. Please know, no supplies in the lab have latex. We have moved away from, we've thrown every glove out that we can find with latex because we recognize people have sensitivities and allergies. So you want to make sure this is the type of glove, it's a sterile glove. And this time you can see it says the size and it does say an expiration date. Now, mine have expired in August of 2018. And again, it's because we don't want to throw this stuff in the landfill because it's great for you guys to practice with. But for purposes in the lab, you'll say the expiration date is current. Okay. If this was in the hospital, I'd throw it out. All right. Okay. So I have my correct size. I got my package. And now I'm ready to hand sanitize again before I start. What if I realize I didn't adjust my table and I touch it? What do I have to do? Say I touch my table. Can I just go to, no. So keep in mind, retouching anything in the room, readjusting the table, touching the trash can, turning my, all those things, you have to re-sanitize your hands. All right, so please watch me first. And luckily there are videos as well that are on Blackboard. This is a practice that we'll do our best to make sure we're reinforcing it with you. Okay, so I'm going to open up my package and you can see I'm just gonna fold my package away and drop my thing at waist height. Now my package says cuff end on it, meaning the cuff end needs to be closest to my body. So I'm gonna go ahead and open my package, and it's okay. The outer part of your package is clean, not sterile. Hold on a second, I gotta get a drink of water. Okay, I touched water. Gotta hand sanitize again. All that shoveling I was doing outside, breathing so hard, my throat is a mess. It was fun, actually, breaking up ice, and I got a lot of aggression out. I don't know if you guys did, but it was kind of fun. I'm over it though. Okay, so my hands are clean again. So I'm going to go ahead and get my package flat. The cuff end is facing me. And I'm going to go ahead and open my package. When I open my package, there's words in there that says pull to open, and it shows a right hand and a left hand. The key with gloving is you always glove your dominant hand first because you have more dexterity, and then you'll do your non-dominant hand. So I know we're a right hand world. I have a left hand son and he complains about it all the time. If you are left-handed, you will glove the opposite hand of me because I am dominant right. So there are two flaps And when you open your own package, you'll see this. I slip my fingers in the flaps. And these are 2018 gloves, so they're a little brittle. All right, so then I open up my package. I'm very cognizant that the inch margin needs to be, I can touch the inch margin, but I cannot touch in the inner part of my package. Now, the way the gloves are laying, they're laying like this, and you can see there's a folded cuff, okay? And the cuff is where I'm going to be focusing how to pick up the glove to put on. The cuff, because it's folded down, the piece I'm going to pinch with my clean hand is going to be against my skin, so I'm not breaking sterile technique. So when I'm getting ready to glove, I kind of tuck my thumb in here. I'm pinching my cuff, I'm pulling it away, and I'm making sure to hold the cuff. I'm going ahead and pulling it on, okay? My finger is on the part of the cuff that's going to be against my skin. I can't do anything else like readjust this glove right now because my fingers are all sterile and I can't touch them with this hand. Okay? Now, what I'm going to do for my left glove is I'm going to tuck my thumb in again, but I'm going to make like a scoop. So I'm going to scoop up the glove by the cuff. Okay? So my sterile fingers are inside the cuff, and then I'm going to tuck my thumb in again, slip my hand in, and pull them on. Now, once I get them on, I can adjust them, okay? And I'm good to go. All right, now that they're clean, and now that I'm sterile, I want that wrapper off my table. So you can grab the inner part of the wrapper right here, because that's sterile, and I'm going to go ahead and drop it. Okay? I'm going to stand here with my gloves on like this while you pull out your sterile gloves. So my hands are going to stay sterile. And the way I know they will is I'm going to keep them like this so I don't accidentally touch my hair or something. So go ahead and pull your gloves out. Hey, Professor Nuttycomb, what if you step by step with them, put the gloves on, and then I will show them how to take them off?
Sure.
You have a pair ready to go?
I have a pair ready to go. I don't have maybe I can make a little elevated surface somehow.
Well, if you walk them verbally through the
Yeah.
steps, I can watch the screen.
Okay. Or maybe, you know what? Maybe I'll just use my desktop. Okay. So let's see. All right. So you have your gloves. And look at expiration date. Some of your gloves might be expired, but we're gonna open up our gloves. And we can touch the outside of the package. And of course, you would hand sanitizer first. I don't have any here before you're touching anything. All right. So you're going to open up your gloves and lay them on a flat surface. Okay.
So, yeah.
Oh, and then once you have them
Jesse,
open,
maybe you could hold up the package like, yeah.
here, hang on,
Back
let me
up.
turn
You're
my,
too close. Yeah, let's see if we can do it that way because I want him to be able to.
I'm going to turn my blur off.
Yeah, that'll help. Okay. So perfect. See how her gloves have the flap right next to where it says small petite? So point to the flaps. You're going to slip your hands in this way. Jesse, show them how to, like the motion, yes. So see how she's scooping her finger in there and she's going to open up the package. Okay.
Open up the package this way.
Like that, yeah.
And then the picture is showing you which one is your left hand and which one's your right hand.
Excellent.
Yeah.
Okay, so now Jesse's going to kind of break sterile technique just so we can show you. So
Yeah.
if you lay it down, so you've opened up your package and you should see the cuffs, so you can see where the cuffs are on those two gloves, right? So with your dominant hand, you're going to pinch the cuff like that, okay? And you're going to pull it up and you're going to tuck your thumb in and slip your hand in.
Professor,
Mm-hmm.
so when you have the package like this,
Mm-hmm.
and when it comes out, can you open it anyway, or you?
Yeah, because the whole outer of the package is going to just stay clean, not sterile, because it's going to be laying on your table surface. So it's okay to undo it and then open it. Yeah.
In any way? Okay.
In any way. Yeah.
Thank you.
Yeah. I like the fact that you're thinking clean, sterile, clean, sterile. And it does help to verbalize it, even if it's just in your brains. Yeah. Okay, so now you're going to take those two flaps, Diana, and you're going to open it like that. And you'll be able to see your two cuffs. You're going to take your dominant or your non-dominant hand and pinch that cuff, and then you're going to pull it up. Yep, and you're tucking your thumb in. Beautiful. You're going to slip your hand in. Good. And then you're going to go ahead and you're going to have to pull that next glove up. You can slip your hands into the cuff to pull it away. You're going to tuck your thumb in and slip it in. And now, if you accidentally put two fingers in one, it's okay. Just get it on as much as you can. Pull it down as much as you can, because once you have sterile fingers, you can adjust. You can slip your finger out and put it in a new, you know what I mean? You just have to, when you're thinking of adjusting, you're just touching sterile to sterile. Excellent. Happens all the time. I accidentally do that all the time, and then I just adjust once they're on. Okay. And then you can sit here like this once they're on. And do any of our colleagues have a question?
And we'll have time to practice this during lab too. And even if you like picked a size that maybe is too small or too big, you can try a new size next week.
Yeah.
Because I know we were kind of just, you were guessing when we were leaving lab last week what size.
Now, I'm going to show you how to take them off, but I don't want you to take yours off this way because you're going to repackage yours for practice. Okay. Faith, do you have a question?
Yeah, Professor, what if it's very hard to put in? Like when I tried putting in this one with my hand, it was kind of going like two fingers was going
Yeah.
into one, and this one I could not see where to put my thumb in. So how do you adjust it without? No, I didn't have this one gloved. So
Oh, you didn't have it on yet?
so how do you adjust it when that happens, when you are just using your two dominant fingers?
It's an excellent question, Faith. If your hand is functioning enough, so I don't have my so what Faith is asking is I'll just kind of demonstrate it. So she doesn't have two gloves on, she only has one glove. So when she put on her first glove, her fingers weren't in the right sockets, right? If it's a functioning enough hand that you can flap with it, it's okay to use that to scoop up the next sterile glove, even though it feels a little weird. Slip your hand into it. And then sterile to sterile, fix that first glove.
Okay.
Okay. Now, if it's just a hot mess and you're like, that is not happening for me, that's when you take out your other sterile gloves that you brought into the room and say, I'm just going to start over. Okay. Yeah, but you can absolutely, because I've done that where it looks like a hot mess. As long as I have the dexterity to get the other glove on, then I fix it once it's on. Okay. Excellent. Good question. Any other questions? So one of the things I neglected to say is to pay attention to how they came out of the package, because I want you to repackage them that way so you can practice again. But I do want to show you how to take them off. The way you take them off is you take your non-dominant hand. Just watch though, because if you ball them up like what I'm going to do, you're never going to get them back in the package well. You take your non-dominant hand and you grab the center of the glove and you can pull it off. And then I ball up the glove like this in this hand. And then I take my clean fingers and slip them in under here. And then I just pull them off like that and throw them in the trash. What that does is it presents as many contaminants as possible from touching my skin. I'd throw them in the trash and then I would hand sanitize again. Okay, if you ball your gloves up like that today, you will never be able to get them apart again. So to repackage your gloves, you're going to open up your sterile package. You're going to position the gloves so they look like this, right hand, left hand, and you're going to fold that cuff again. Okay, so you can think about slipping them on. And luckily, our packages give you a little description. I don't know if, is it blurry? Yep. Jesse, is yours better than this? Your package? Can you see this?
I think it looks okay, but I
Oh,
can.
okay. So when you're repackaging them, you can see right here, there is a, yeah, that's how the gloves should be put back and you'll fold down the cuff. Are you hanging in there with me, people?
Yeah, I had two questions.
Excellent.
Okay, so I saw in the video that the girl had these two flaps right here, this one and this one.
Uh-huh.
He had kind of like bent them over.
Yeah.
Are we able to do that?
Sure. Depending on how they open with the flaps, those may be in your way, so it's okay to turn them down. When you think about your gloves, the sterile package, right? It's the same principles. The part of the package that's against the table is no longer sterile, and you're thinking of the 1-inch margin around your gloves, right? So you can go ahead and fold this back with your fingers because I'm just using the 1-inch. Totally fine. Same here. Totally fine. What you can't do is once the package is all the way open, you can't put your hand in the middle with your clean hand. Yeah,
Right.
that's a very good question.
Yeah.
So I did my flaps and now I can do the center flaps and just
Open
fold
it.
back my package.
Yeah, because I found it very difficult, like just opening it that way. Because
Yes.
the flaps from the sides would get in the way.
Yeah,
and
they kind of made it keep shutting on itself. Yes. Good pickup.
And then on top of that, when we open the package, right? Does it matter if it like you know how you said it has to be on the cuff end? Let's say like I open the package and then it falls on like the size
Yep.
M, for example.
Yep.
Are we able to turn that around or?
Yes.
Okay.
Yeah. One of the things I want you all to do, because it's really hard to memorize steps, it's much easier to think what needs to stay sterile, what needs to stay clean. And you've already learned these principles today in knowing you physically have to touch things with your clean hands. But once you touch the package, you just have to think that part of the package is no longer sterile. I got to remember that, right? So when you're walking through each of the steps, in your head say, okay, there's a clean edge, sterile in the center. The package, the cuff is pointing the wrong way. I can rotate it because when I open this part is going to be against the table. So think it through like that, and I think it'll come together for you much better. And the other thing, you can then translate it to other sterile and clean procedures you do. Yeah.
Got it. Thank
But
you.
you're already doing that because you already questioned me about it. So your brain is doing it. So good. Do we have any other questions from
I have
Anybody? Yeah.
where would we put like the glove packaging if we already have the sterile drape
Mhm.
on the table?
Excellent. So say I have if I have my sterile drape open, I'm sorry, say the question again.
Yes, if we have the sterile drape on the table, where would we put like the glove packaging to put them on?
That's a great question. So close your eyes because I'm not going to use sterile technique to open my drape a second. But all right. So I have my drape and I opened it sterilely, but I need to now put gloves on, right? What I like to do is I will put my hand sanitizer somewhere where I can use it. And then I stand to the side of my sterile field. So my long overbed table, most of it is taken up by the sterile drape, but there is about a 3-inch margin right here, or it's more than that, 6-inch margin that I can stand sideways and open up my sterile drape or sterile gloves right here. Okay, so because they're touching the drape a little bit, but they're only touching on that 1-inch boundary, it's okay. So then I'm going to open up my gloves here. And I can put them on to the side here. So I purposefully, my thumb isn't in there to show you how I'm going to fix it later. I'm going to scoop this up, put this on. And these are extra small gloves, so they're tight. So you could see I'm fumbling a little bit, but I can redirect how to put the glove on as long as I'm keeping sterile to sterile, okay? See, I'm on the outer side, I'm not touching my skin, and now I can fix my thumb, okay? And gonna throw this away, and then I can move around in front of my drape. So if you use the side of the overbed table to open your gloves this way, that's what works well for me. Does any of the other faculty have a tip about that? Some method they like to do, or is that the method you use as well?
That's the method that I have always used. So.
Yeah, yeah.
Same here.
Okay.
I
All
have
right.
just a quick
Same.
question.
Sure.
When I was putting mine on, I think I might be a little small because I was kind of struggling to get into them. Is it better to have a little sort of give in them? Is that sort of ideal?
I think when you're learning, it's okay for you to go up a side just to kind of get the psychomotor skills.
Yeah.
And then when you translate it to practice, you really want them to fit you well because you need the dexterity. But when I demonstrate to students, I'll wear a size larger. It's easier for me to get them on. I can do it quicker, whatnot. So that's okay. But if I'm in the clinical setting, these fit me well because there's no gap in the fingers. Because there's nothing when you start doing things, you need that dexterity.
Got it. Okay, thanks.
You may also find yourself between glove sizes, like you're like, this one's so tight. Come to the lab, we'll give you the size up, and you can see where you feel comfortable. Okay? All right. Good. All right, we're moving right along. So I'm going to show you once again how to take my sterile gloves off and so I'm going to pinch in the center. I'm going to pull my glove off. I'm going to ball it up into my other sterile hand. I'm going to slip my fingers in next to my skin and pull them off as a unit. And see how it's inside out now? Now any yucky or pathogens or anything are inside, and I'm just going to go ahead and throw them out. Okay. Now, before I might have like bundled up my sterile drape and then thrown that in the trash and then took my gloves off, whatever makes sense. But I'm going to get rid of this now. All right, I think we're ready to move on, right? All right, let me put my table down. I finished my procedure, so hand sanitize again. Okay, let's see where we are then. I think we're ready to move on to PPE. Okay, so what we have last to do, or we're going to do a couple things. We're going to learn about putting your personal protective equipment on, all right? And then I have a way for you to record yourself on Blackboard putting your PPE on so that you can get some targeted feedback from faculty. So I'm going to walk you through. I'm really excited. This is the first semester I've had this technology, and I was very sad about having a snow day, but I thought this is going to be a great way to try it out. And I'll walk you through that in a little bit. The only people that will see your recording is your lab instructor or myself, okay? We don't share it with other students or anything like that, and it's really for you to do repetitive practice surrounding PPE. So I will demonstrate that in a little bit, and then the rest of the time we're going to reinforce talking through vital signs and practicing and making sure everyone's using their stethoscope appropriately and all the things, okay? Everyone hanging in? Need a stretch break? We're good. I don't think we're going to go all the way to 1 o'clock, but I am going to be available through the whole rest of the time if you have other questions. All right, let's keep going. Where's my mouse? All right, so I'm hoping you had time to look at the recordings about personal protective equipment. And when we mean that, it's these kits that we gave out in the lab. Personal protective equipment is, well, how about somebody tell me what it is? What do we use it for?
For protection.
Yes,
prevent infection.
against, or who are we protecting?
Ourselves and the patient.
Excellent. Yes, thank you. It's a two-way street, right? We want to protect the patient against any pathogens from another patient, you know, or ourselves, or also patients have infectious agents that we have to protect ourselves against. So when you're thinking about placing PPE on, I want to make sure when we're talking about it, the first thing is a gown, and the gowns for you and your kits are yellow. The video, sometimes they're blue, sometimes they have string, sometimes they have a loop around your neck. When you go to clinical, you may see a different product, but the principles translate. So in the kits we gave you was a gown, a surgical mask, right? There are different levels of protection with masks. There's KN95s or N95 masks. There's PAPRs, and if you you should be familiar with all of the different types of masks, but we protect ourselves according to what the pathogen or what the microbe is in the air. Surgical masks are what we're going to be practicing with today, so we're going to make sure you know how to put one on appropriately. You also have gloves. These are just clean gloves. They're not sterile gloves because we're not doing a sterile procedure. We're just protecting ourselves. And the last thing you're going to have is a mask. A little bit about this, or sorry, a face shield. The face shield, when you open it up, It has a film on it. It looks really cloudy. So you need to peel off. You got to peel off the layer. And then when you look through the visor, you're like, oh my gosh, it's so much better. Okay. So I'll let you prep your shield or your face mask so you're not looking through clouds. And let's see, 1, 2. And then we're going to answer the questions on the board here.
Professor, are these slides on Blackboard?
Yes, I'm going to share them to you. And then we're recording this as well. So I'll make sure that the recording and the slides will be on Blackboard.
Oh, so we don't have access to this PowerPoint just yet.
If it's helpful to you, Professor Netticombe will see if it's open to you and she can post it.
Yeah, if it's not open, are you okay if I just open it up?
Yeah, go ahead. Yeah, sure. Absolutely.
Thank you.
Sure. All right. So let's think about what is the proper order for donning and what's the word donning mean?
Putting on.
Right? You're going to put it on. Doffing is taking it off. So donning is donning personal protective equipment. Now, this is the routine way we put PPE on. Different circumstances may vary a little bit, but in general, what is the proper order that we place PPE on? And anybody can just unmute themselves or put it in the chat. What do we think? Jesse, can we advance one slide at a time or is it all of them? The answers show up at all of
The
them,
answers
right?
will show up in all of them.
Okay.
I'm seeing a lot of almost all A's.
Okay. All
Yep.
right. So applaud you because that is the way we put PPE on. We typically begin with the gown. We'll put our face mask on and we're going to practice how to do that appropriately. Goggles, or today we're practicing with the face shield, and the last thing you're going to put on are your clean gloves. So now we're talking about a specific condition. We have a patient who's on droplet precautions, and they need to leave their room to go to a radiology and get a CT scan. So this is a patient who's going to move from their hospital room out into the public area. How should the nurse address the droplet precautions? What do we think? What are we getting for answers there? Excellent. I hope no one would be holding a sheet over their mouth. This question's kind of funny. I mean, yes, throw a sheet over the patient's head and hope for the best. So yes, the answer is D. Okay, we're trying to make you laugh a little bit. I know this is hard to learn online. Oops, sorry, I just gave you all the answers. Okay, so now we're going to PPEs required for the patient who's on contact precautions. So this is somebody that you're worried about contact precautions. What do you think you need?
We need our gowns and gloves.
Yes, excellent. You just need to make sure you're protecting your uniform and your hands, okay? Because you don't want to be spreading that around. All right. And then your last question, the person is diagnosed with and they're on airborne precautions. So which one is that?
Is it A?
So people are thinking A? Any other thoughts?
C.
Okay, so we're going to move to the next slide. The reason the edits here are my verbs are covering it. I can't read what C is completely, but tuberculosis is very, it is airborne. Influenza, I can see why this question be a little confusing because we do worry about airborne with influenza as well. Tuberculosis is something that we really are aware that we have to use the utmost in precautions with respiratory precautions because it's the way it's spread. They have to be in a specific room for that.
Sorry, Dr. Sher, I have the list if you want me to read it. So it's tuberculosis,
Oh, yeah,
measles.
please.
Yeah, tuberculosis, measles, and disseminated herpes zoster.
Yeah.
Are all airborne.
Anna Maria, do you have a question?
Yesterday's class, I think we learned about those airborne diseases.
Yes. Oh, excellent. Professor Dennison and I work really closely together with the other first semester faculty to try to make it all make sense so you're hearing things repetitively from us. But yes, so when in doubt, and I understand at this point in it's week 2 of the semester, you're just becoming familiar with different diseases and things like that. But it is just kind of thinking it through. How is the infectious agent passed? Is it through droplets? Droplets, you have to be at least give the patient about 3 feet of distance because the droplets are kind of heavy and after 3 feet they drop to the ground. So you kind of have a 3 feet shield around you. Airborne are, you have to be really concerned that, you don't want to be in the same space breathing their same air as them without protection. Okie doke. So now we're going to move on. PPE is it a sterile procedure or a clean procedure?
Clean procedure.
Excellent. Yes, it's clean. So we don't have to be quite as precise, but we do it in a rhythmic fashion. So this we can do all together, step by step. I do think it'll be a good experience to reinforce it by recording yourself later, so you can have specific feedback from your faculty, and I'll show you how to do that. Again, we're just learning how to use this recording technology. I'm hoping it will help us give you specific feedback about your skills, and we're going to try it out today. But for now, I'll walk you through how to don your PPE. So in the video, when you record yourself, you'll don it and you'll doff it as well. Okay. So I'm going to stop sharing my screen so you can see me. So I have my supplies. Just went into the supply room over here and got gloves. So I'm good to go here. Let's see. Get this off here. All right. So I have already talked to you about what we need. I need a gown, I need a face mask, I need gloves, and I need a face shield. So I don't need my overbed table in front of me, but I am going to use hand hygiene as I enter the patient's room. I'm going to identify my patient. And then the other thing, I'm going to go to the doctor's orders to see what kind of isolation precaution my patient is on. My patient is on transmission precautions that I absolutely need a face shield as well. So we're worried about splashing into my eyes. So we're going to use a face shield for that. All right. So I'm going to take my gown. And this particular gown has a tie at the neck and a tie at the waist. So I try to I'll just slip my arms in the gown like this. One of the things in the hospital, you may have gowns that have loopholes here, so you put your thumbs in. If you guys wear leisure wear or things, you're familiar with that. That just helps keep the gown pulled down tight over your wrist because if the patient has something transmissible, you don't want it on your wrists. This is just kind of the regular elastic. All right. When I'm touching my gown, I just stay in the habit of touching the inside of it, even though I haven't gone into the patient's room and nobody's coughed on me or gotten anything on me yet. It's just a nice habit that I always touch my gown from the inside. So they're one size fit all, and they're kind of big. So you're going to tie this behind your neck. And because you're going to reuse this stuff, try not to tie it too tight because it's going to be hard for you to get it apart. In the hospital, you will not reuse it. And then I'm going to reach around and find my ties in the back. And you're going to find some nurses like to loop it in front and tie in the back, and some nurses like to tie in the front. For these purposes, because I want to show you both ways, I'm going to tie it in the front and we're going to talk about that. Now, one of the things that we do, if we have somebody who's really on tight isolation procedures, and you will have a buddy to make sure that your gown is completely closed in the back, because pathogens like to go everywhere. And if you're working in the environment, so you may have a buddy to check, yes, my back is completely covered. All right, I got my gown on. What do I need to put on next?
Your face shield?
Not my
Your
face
mask.
shield, my face mask. Okay.
Your face
So what I want to do is the dark blue side is out, but I want to feel for the little, there's like a little metal pliable thing in the top of my mask here. So I'm going to loop my face mask around my ears. I'm going to pull it under my chin as I pull it like this. And then I take that little metal thing and I mold it around my eye or my nose. Okay. So you see that I pulled it around my chin and it's completely enveloping my face. It's kind of forming to my face. If you have glasses, it's a pain in the neck because it kind of mists them up. So you have to kind of get used to. There is some products you can use on your glasses to kind of help with that. All right. All right. So
Be
what do
gentle
I
with
do
him.
next?
Gentle.
What do I use? What do I put on next?
Yeah, shoot.
My face shield. Okay. So my face shield, I don't want to touch the outer thing. I'm just going to put it up around my face, on my forehead like this. Okay. It's nice and fits okay. And then the last thing I put on are my gloves. So when I put on my gloves, I want to make sure that I cover my gloves kind of tuck over my gown so that my wrists are not showing at all. Okay. Okay, I'm ready to go. All right. So I went into my patient's room, I did all my things, and I'm ready to leave the bedside. How do I take it all off? What do I start with?
Gloves.
Gloves. Okay. Now, this is when you have to think, how is my gown tied? Because I tied my gown in front, I want to untie my gown before I take my gloves off because this area may have come in contact with something, right? So I'll keep my gloves on, but I'm going to untie my gown here at the waist. Okay. If you tied it behind you, you can go ahead and take your gloves off. Okay. So you'd only untie your gown if it's in front. If you tied it in back, you can wait and take your, you'll take your gloves off and then untie it. All right, so same thing when I'm taking my gloves off, I'm going to pull them off, ball my glove up in this hand, slip my fingers in this way, pull them off and throw them out. Now what?
Face shield.
Take off your gown.
Say
Gown.
again.
You take off the gown.
So depending on how what's going on in your patient's room, you can take your face shield off, then the gown and the mask. It's okay. Your mask will come off last. For these purposes, do you want me to take my face shield off first or my gown? What do you think?
Your gown is okay because it's not been contaminated or anything.
Okay. So if I'm taking my gown off, I want to make sure that I'm touching the inner part of the gown, and I kind of shrug it off like this. So I'm not touching anything on the outside of the gown. And then I roll it up. I'm only touching the inside that had touched my uniform, and I can drop it in the trash. Now it's okay for me to take my face shield off. I want to make sure that I'm touching the just the elastic. I'm not touching the face shield itself. Get rid of that. And then I'm ready to take my face mask off last. I go ahead and just pull the loop here and here, pull it off, and then drop it in the trash. Okay. Are there any questions? Should see my
I have a
floor.
quick question.
There's a lot of stuff on the
In the video, I think it mentioned like if we had the N95 on, you take that off outside of the patient's room.
Yes.
And I was just wondering if you're wearing a mask, is that okay to take off? Does that have to, do we wait for that one as well? Like any sort of mask, regardless if it's an N95 or not?
Yeah, so it depends. That's why you have to always know what are you protecting yourself against, or protecting the patient from. Um, Typically, I go there. A lot of hospital rooms have like a little ante room or a little before you hit. I usually take my PPE off there. I always take my face mask off last. However, there are certain rooms you need to take your respiratory mask after you exit the room because they're afraid you'll breathe something in prior. Yeah. Abby, let's see. Yes, I mean, since it's sterile procedure, central line. Yes, okay. What about hair? Yes. Laura asked, do we wear a hair cover? Yes. If you have somebody who has are actively coughing, you have to think it's the particles all in the air, so you might want to cover your hair as well. Okay. All right. Let's see. Would you all like to practice putting it on? Do you want to save it for your recording? What would make sense to all of you? Let's see. Oh, Laura, the recording is due. I know you have things going on. Let's say it's due like we'll give you to Saturday. What does that sound like? Save it for recording. I think actually I want to save it for recording. And can I tell you my rationale? It'll be the first time you put it on and take it off. So just recall, before we leave, I'll show you how you are going to record it. I think it would be good if it's fresh, a fresh time putting it on. And remember, it's for feedback. There are checklists that walk you through the donning and doffing process. You can review those on Blackboard. It says practice during lab. And then you can go ahead and just show us what you know. Okay? All right. So let's keep going. I think we have a few questions just to reinforce about PPE, like a few scenarios. And these are helpful for when you're doing foundation or, during class, because you may have test questions surrounding if a patient's displaying these symptoms, what kind of PPE would you wear? Okay, so let's see. Here is the CDC guideline for taking off PPE. Okay. This one does show gloves, face shield, gown. Again, if that's the way you do it, it's okay. The reverse is okay as well, depending on what you're preventing, what the pathogen or airborne particles in the room. All right, hand washing we already did. Okay, so let's these scenarios were they were going to be a group activity in lab, but let's just talk them through, okay? So this is a patient he's 70 years old and he's admitted to your medical surgical unit. The patient has fever, fatigue, and sore throat. He's being treated for presumed influenza. So when you hear influenza, you think, what kind of particles or what kind of pathogen is that and how is it transmitted? So what isolation precaution would you expect for this particular patient?
Is it both like droplet and airborne?
You're worried about yes, you're worried about airborne precautions, right? Because influenza is or droplet precautions. So what type of equipment would you use to protect yourself and others?
Surgical masks or mask and the face shield as well.
Yeah, I think definitely a face mask. If you're the face shield, I always think about that if you're worried about splashing in your face or like, so I think that the face mask, also if they're actively have a productive cough, I'd be concerned. Usually you put a face mask on this patient too, especially if they're leaving their hospital room or if they're having family members, but you definitely need to wear a face mask and protect yourself from influenza. What kind of hand hygiene do you need to do soap and water or do you need is hand sanitizer? Which would be most appropriate for this patient?
Hand sanitizer.
Yeah, hand sanitizer is fine, right? As long as you're using it appropriately and you haven't touched any bodily fluids, hand sanitizing is just fine for this patient. All right, here's the next scenario. Oh, it is saying eye protection, so it's assuming the droplets can get in your eyes. So you're going to use a face shield or goggles. You can wear goggles. All right, so now we have a 30-year-old female who's a productive cough for weeks. They have weight loss and night sweats. She's being treated for tuberculosis. So the symptoms this scenario is sharing with you are classic. If a patient presents with night sweats, unexpected weight loss, and cough, we always want to rule out tuberculosis. Montgomery County has a very, very small rate of tuberculosis, but we do have some cases. So we have to make sure we understand how to protect ourselves. What type of isolation would you anticipate when caring for this patient?
Airborne.
Airborne, yeah.
And the highest way to protect your airway, what kind of isolation would be in this room? Here, let me.
Negative.
We haven't spoken about this, and I'm not sure it was covered in your didactic courses yet, but it's something called a negative pressure room. Have you heard of those? You would definitely wear an N95 mask or respirator because that's the highest way, you can present yourself from breathing the airborne pathogens. A negative pressure room means the air circulates in the room and it kind of keeps the air there. So like when you open the door, none of the air leaks out of the room, if that makes sense. So you're controlling the environment so that when nurses and doctors come and go, you're isolating that air is staying in the room and not contaminating out into the general population. So there's usually only a few negative pressure rooms in a hospital, and these are earmarked for patients on the most strict airborne precautions. The captions are covering my last question. I think it says what hand hygiene is appropriate for
Yes,
this
hand
patient.
hygiene.
Yeah. Oops. and I think I just clicked it.
I don't think you can see it anyway.
But what do we think for airborne precautions? Just when you're thinking about it, does that make sense? How it could be, if it's transmitted, how do you have to protect your hands?
I feel like I would use both, both hand sanitizer and soap and
You
water.
know, I don't disagree with you because it's never wrong to use soap and water. It really isn't.
Yeah, it's
And
just
when in doubt, go ahead. But I would really review these slides before you take a didactic quiz because I do feel like we try to give an answer that's consistent, but minimally you need to use hand sanitizer. But I'm with you. I might wash my hands along the way as well. All right. Now we have a 35-year-old female
Um,
patient. Yeah, sorry.
Can I add something?
Yeah, please, Abby.
I just want to bring to the students' attention, normally the N95, when you are in a hospital setting, it has to be fitted. So you will be going to have the fitting test. So that's one thing that I want to bring. Another thing is when you are going to the airborne rooms, always have the habit of checking it's on. It's not like necessarily always on. When you go to clinicals, you can always just like, hey, I want to see the airborne rooms. So that way you have a clue. It's always good to see what it looks like, but make sure it's on always.
Yeah, so we used to fit every single student for a mask prior to going to clinical. That happened post-COVID, but recently we've moved away from that. However, your clinical instructors will absolutely work with you to protect yourselves, and you won't be asked to go in a room that you don't have the appropriate fitted mask. And I love what that Dr. Belay is saying is always be curious about different rooms and what's going on in the hospital because your clinical instructors really can help bring all this to life by pointing these things out. Because then when you see the patient and it kind of clicks for you. All right, so now we have a 35-year-old patient who just had bowel surgery, and post-operatively, she has a colostomy drain with fecal drainage present. If you're unfamiliar with a colostomy drain, a colostomy is a surgical procedure where they bring a loop of the bowel to the outside of the skin, and it's usually because the patient has some kind of they're either their bowel needs to rest or they have some kind of cancer that they can no longer go in the traditional way. So they'll have this little colostomy. It's a little stoma that comes outside the body. So this patient, her stool is coming out of this stoma. What type of isolation would you anticipate this patient would have?
Contact precautions.
So this is just a standard precautions patient because it's just the same as any other patient that you know eliminates stool in the traditional way. There's no extra precautions other than, of course, you're going to wash your hands. You're going to make sure that if you come in contact with a stool, you would, wear gloves, clean gloves, and make sure you're taking those precautions. So that tags into what equipment would you use if you were coming in contact with this patient?
Mask and gloves.
So just gloves. And can you tell me a little bit about the mask?
No,
What should,
I was just thinking that maybe if we wear a mask like that, we don't have to, just in case if we touch anywhere near our facial, um, like
oh,
hair
oh,
or
you're
anything is, I'm concerned for that reason. But
okay.
glove is like more reasonable, yes.
Yeah. One of the things that we think about too is that this is a relatively young patient, a 35-year-old person who now has this colostomy. And there's a lot of body image things that can happen when people no longer eliminate in the traditional fashion. So I like to make sure I stay protected, but I'm also aware that I don't want to message the patient that, it's smelly or I have to control my facial features. So I'm always, you kind of balance these things. Protection and safety always come first, but also the psychosocial needs of a patient with a new colostomy, you kind of think of that as well. What hand hygiene method is most appropriate for this patient? And I'm just saying if you're entering and exiting the room, not that you're doing anything with colostomy.
Soap and water would be hand wash.
Sanitizer.
Yeah, just hand sanitizer. So this is just a standard precautions is just hand sanitizing. Now, if you were emptying her colostomy, obviously you would absolutely wear gloves, and you do hand hygiene after you touch something like that, just to be sure that because we know that you would do that for a patient who eliminated in another way as well. All right, we have one more to go. And this is you just arrived at work and you find out that you're getting an emergency room admission, and it's someone who's been experienced diarrhea for a week. They're having 3 bowel movements per day, and it's suspected that they have something called Clostridium difficile or C. diff. Are you familiar with this term, C. difficile? Have you heard about it? Okay. Joelle, would you share what you know about it?
It's a bacteria that forms spores, so it's very difficult to get rid of. And it's one of the most common hospital-acquired infections.
Yes, absolutely. So when you're thinking of this is something that's very transmissible from patient to patient, and you have to think who's transmitting it, patient to patient. It's people coming in and out of the rooms. So what type of isolation would you anticipate when caring for somebody who has this diagnosis? Yes, I see everyone's writing in the chat. Oops, sorry, that's right. And you're going to contact precautions, enhanced barrier precautions. Are you surprised that for this one, you're going to wear gloves, gown and gloves? Now, you could include a face shield if you feel for any reason there may be splashing that could get in your eyes, say, but if you're not concerned with that, you don't need a face shield, but you definitely need gown and gloves. And the real important thing here is hand sanitizer does not work for C. difficile. You must use soap and water. And I think I told my lab students this story last week. I have a friend who went into the hospital recently. She's having a valve replaced in her heart. She came home from that procedure and was just fine, recovering well. But 4 days at home, she was diagnosed with C. difficile. And we recognized that that was something that she picked up in the hospital. And the trajectory of the next weeks for her were really difficult. She got so sick, she had mentation changes. It was really hard. And the hardest thing about it as her friend was recognizing it was an avoidable thing, that it was a hospital-acquired infection. So I can't stress enough. It goes back to one of your professors saying, if you see somebody doing something wrong, you need to say something. So if you see somebody coming in and out of a room and they're not washing their hands, they're not using the right protocol, please remember the story of my friend, because it is very important to say, hey, you might have, please make sure you're using soap and water. This is a patient who has C. difficile. Okay, so that's my little story there. All right, we have concluded the new topics that you will that you've learned this week. Before we chat about vital signs, I'm going to go onto our Blackboard to show you how to do the Go React recording. Okay. And then we're here to support your learning and reinforce techniques surrounding vital signs. Okay. All right. Let me just escape out of this second. Oops. All right. Okay. Yes. Ellie, we are going to do a little more about blood pressures for sure, talking about reinforcing technique and yeah. Okay. Okay. Everyone see my Blackboard? Yeah. Okay. So this Go React activity is you can't see everything I have here. This is the instructor view, so just ignore some of it. But it'll be listed as Go React right here, okay? It'll be a separate, you should be able to see Go React week 1 and 10-hour community and then week 2. All right, so you're going to click on this. And right now, Professor Nuttycombe and I practice, and this is all we're going to ask you to do as well. So what you're going to do is down here, it says view instructions and start activity, okay? You'll hit view instructions and there's a long little message from me that's basically saying, I really want to try out this platform. I'm excited that I have it to offer you today. And you're going to practice donning and doffing PPE. So basically, you're going to just walk through the steps of somebody who has transmission-based precautions that require a gown, glove, mask, and face shield. So we want you to put it on in the correct order, and we want you to take it off in the correct order. You can speak to us, it records your voice, it does all the things, okay? And there's some instructions for you here. So that's what it looks like. When you close it down here, you're going to move back over here and it says start activity. So I'm going to go ahead and start it again. And it's going to ask you for a title. And all you have to type in here is your name. Okay, so the title is your name, and then you'll hit continue. And it's going to, I hope you can see this because I know I'm on Zoom, but it's going to be, right now I'm on Zoom with you, so it's saying my camera's failing, right? But when you are no longer on Zoom, it'll say your camera's okay, your microphone's okay, and your connection's good. I have a feeling it's not going to load for me very well, but once it does, you just hit continue. And it's going to show, you're going to see yourself in a video, and then your instructions for the activity are still there on the side, so you can refer right back to it. There's a little record button, so you're going to get all your supplies together, you're going to stand in front of your camera, you're going to hit record, and then just go. You're going to put on your PPE, you're going to take off your PPE, and then you'll hit stop. If for any reason you need to hit pause because, you have a dog that runs in the frame, you have a kid who really needs your attention, that's okay. Just pause your video, okay? And then you can restart it. I made it so you can only do one attempt because I don't want to stress you out. I want you to just do your best so we can give you some feedback. I could make it to 2 attempts if you feel like you want to perfect your technique, but again, I don't want to stress people out. I just want you to give me one effort.
Dr. Shaver,
Yeah.
someone asked, so if they recognize that they make a mistake, do you want them just to verbalize, oh, I made
Yes.
that
Yep.
mistake?
Yeah.
So you don't have
Yep.
to you could just verbalize, oh, I shouldn't have done that. This is what I would do if you made a
Yes.
mistake.
Yes. And then this is the other thing, because I want our faculty to give you feedback. At the end of your recording, you could say, I do have a question to clarify. Could you please tell me, and whatever that it is? Because this is our dialogue, and I really wanted some way for us to connect with you personally today in regard to the fact that we are on Zoom. So anyway, so it's pretty intuitive. We tried this with our second semester students and they picked it up pretty quickly. You can always send me a Teams message if you're having trouble with it. Right now it looks weird because I'm on Zoom and it won't let the camera work. So this button would turn blue or red, I can't recall. You'll hit continue. You'll see a record button, you'll record it, and then I think there's a submit button when you're done. Okay?
Dr. Schaefer, sorry, Lejang asked a question. I guess she's clicking on the instructions and it says there are no additional instructions or attachments for this activity.
It'll show that once she's in it, because when we trialed it, we had it. You recall. And because I'm in the faculty in the course, I can see all the videos. When you submit yours, you'll only be able to see your own. The other students won't
They
be
can't see
listed there.
mine.
No, yeah.
Mine is my 5-year-old.
Oh yeah. Oh, she's really cute. So that would be
She's
fun.
a hot mess.
All right.
And Ellie, so it's under, if you log into Blackboard, it's
Yeah.
right under the IPE requirements for M349.
I think what
Yeah.
I'll do, Professor Nuttycombe, would you do me a favor and move Go React into week 2?
Sure. Yeah, I'll
And
do that
just
right now.
drag it and drop it in week 2 so they only have to go to one place.
Okay.
And then you could put it above the Prepare for Lab each week folder, and that way it's one-stop shopping, just to
Okay.
keep. And I'd love to hear your feedback if you like this, because it is a opportunity for you to practice skills and get direct feedback. Okay, let's return to vital signs, right?
And Dr. Schaefer, I'm sorry, one more question.
Sure.
So for this video, will we be recording the process of putting on surgical gloves as well, or just the gown and gloves? So just
PPE. I will tell you this, if you feel like you need feedback about draping or gloves, you could include that as well on this particular video. Or you can bring your curious questions next week and we'll try to include practice in lab next week. But for your time purposes, I think you probably just want to do PPE. Okay. All right. Click through these. All right. Let's begin with a refresh, okay? I'm going to get my blood pressure cuff out, and I want to talk about how to correctly choose the size of the cuff. Can anyone unmute themselves and tell me why this is essential? Or they can write it in
the wrong cuff can cause the wrong type of measurement.
Absolutely, yes. So for your own cuff, I want everyone to find the bladder, okay? There's a Velcro piece. That's not what we're talking about. We're talking about the bladder of the cuff, okay? Professor Nuttycombe, do you have a willing child that would step into the frame to show how to put a cuff on? Or
Oh, I have multiple willing.
I know. Would they be willing so that we can demonstrate?
Is Azzy here? Taylor, can you be my? I'm gonna make my husband do it. I don't know where my children.
Right. So everyone feels the bladder. So it makes total sense. The bladder is the piece that goes around the arm and inflates to stop blood flow. Because basically that's what you're doing when you're taking a blood pressure, you're stopping blood flow. And then as you release the valve, you're letting air out of that bladder, and that's how you're getting your blood pressure. Okay. So take it from here, Professor Nuttycombe. Show the dynamic. Thank you, Taylor, for being a willing person.
So one way to just like a little trick, how I think a fast way to find the bladder of the cuff is, you can sit down, is if you look at the cuff, the part that has the little tubes going up into it, that's usually how you use to find the bladder. So you find the tubes and then that's the bladder. So when you're measuring this on a human, on a person, so I'm going to use my bladder, and then I'm looking at the circumference of their arm where I'm going to be placing the cuff, okay? So what I'm going to do, I have my bladder. You can look at one of three different things, okay? So you can look at the length of the bladder, so the end all the way to where there's like a seam right here. So if I were to wrap this around the patient's arm and to look, this should fit about 80 to 100% away around the arm. Can you do your other arm? It's hard to tell with your. There you go. So you guys, can everyone see that? Is it hard to see? So if you look, this
I can
size cup,
see it.
so if I wanted the appropriate size, this needs to go about 80 to 100% around his arm. Does it look like it goes 80 to 100% or less than that? Less than that, right?
Mm-hmm.
Okay, so already I'm looking at it, I'm thinking this cuff is probably too small for this patient. Okay, so you can look at it that way. Another way is you can, again, with your bladder, I'm looking at the width, okay? So this is the length of the bladder. Now I'm going to look at the width. Okay, so another thing I can do is, again, looking at the circumference of the patient's arm. I can take the width and put it around their arm. This should be about 40 to 50%. So it should go about at least 40 to like halfway around the patient's arm. So again, you guys can see this cuff is probably too small for him. Okay, so I actually have a large cuff. So let's see, that's a regular size cuff. So let's look at this again. All right, so again, with a bigger cuff, I'm finding the bladder. I'm seeing where these tubes are going in. Okay, that's the part of the cuff that's going to inflate. Here's my length. It's longer because it's a larger cuff. Now let's see. So if I wrap this around, here's the length. Okay. Can you guys see? Does that look like that's about 80 to 100% around his arm? So it looks better, right? Okay. And then another way I can check is, again, now I'm going to look at the width. So if I put this on here, it should be about 40 to 50% of the arm. Okay, so I know it's probably hard for you guys to see, but it's about 40%. So I think for this patient, looking at those two things, this would be the appropriate size for the patient. Okay, does anyone have any questions about that, or do you feel pretty good about measuring?
I feel pretty good about it.
You feel pretty good about it? Okay, so let's talk about, Dr. Shaver, do you want me to talk about the placement of the blood pressure cuff?
Yeah, keep
Okay.
going.
So, and you guys can actually feel on yourself. So what I want you to do is I want us to practice finding the brachial pulse on ourselves. Okay, so the brachial pulse is the artery that we're using. We're actually going to auscultate it. So we're going to listen to the brachial artery when we're measuring the blood pressure cuff. Or sorry, when we're measuring the blood pressure. So what we want to do is when we place the blood pressure cuff, so if you look at your cuff, it's going to have a little indicator on it. So I don't know if you can see that, like an arrow that will say artery. Okay, so we need to palpate the patient's brachial artery and make sure that this arrow is lined up with that artery so that when we're listening, we're making sure that we're listening in the most appropriate spot. Okay, that's going to help us to hear and then ensure that we're getting the most accurate reading. Okay, so if you look at your arm, so the brachial artery kind of runs along the inner part of your arm. So if you, I kind of usually like at the bend of the arm right here, like the antecubital area, if you press kind of right there, and sometimes you might have to use a little bit of pressure to feel. Sometimes if you're having trouble feel, start with a little bit of pressure and then kind of gently pull back and see if I can feel pulsation. Okay, so I'm sorry, my kids are yelling in the background. Is anyone, are you guys able to find it on yourself? So if you're feeling on yourself, are you able to feel it?
I can't feel anything.
You can't feel anything. And we'll have the opportunity to. It can be a little tricky to feel as you're practicing, but this is something too. We're happy to help you in open lab, and during lab we'll have the opportunity to practice as well. But it might be in a different place than everybody, but usually if you find that antecubital space, it's more on the inside part of the arm. Okay? So you're gonna
I found what helps is also going diagonally from the thumb. And at least for me, that's what I found that helps me to find my brachial artery. Like you see the patient's hand is laid down, and then you just from the thumb you go diagonally and it's right there.
Huh. Okay, so like on the opposite side of the thumb?
Yeah.
Are you talking about the radial artery or the brachial artery?
The brachial.
Okay, so you're feeling like up in the bend of the arm?
Yeah.
Normally, what I tell students to remember is just see where your pinky is, and it kind of like make a line up until the crest, then kind of palpate around that area.
Yeah. You might have to press a little firmer than a radial artery or radial pulse because it's deeper. You don't want to occlude it by pressing so hard you block it, but see if Dr. Belay's tip and then also pressing a little firmer if you can feel it. Try to use 3 fingers, the pads of your finger. And I love if you want to mark yourself with, I saw that. That's a wonderful technique, student. I love it. But if you want to, I'm feeling mine right now, and it is, it does, it takes a little more pressure than a radial artery.
And it does. It should feel like a heartbeat. It should be just like when we practice counting a radial pulse. That's exactly how it should feel.
Yes.
Okay. And then if you press like Dr. Schaefer was saying, sometimes it can be a deeper artery, so you might have to use just a little bit more pressure in order to feel it. So once you find that artery, I'm gonna line my arrow up with the artery, and I'm gonna place the end of the lower end of the cuff about an inch or so above where I'm feeling that artery. Okay. Once I do that, I'm gonna wrap the cuff around. You want it to be snug but not too tight. Usually if you can fit like 1 or 2 fingers underneath, that's the perfect tightness to put it on. Okay.
So, would you be willing to show how to take the brachial pulse pressure?
Oh, sure.
And mostly Taylor, are you willing to?
I'm already here.
Oh, thank you.
I told him.
Yeah.
So
I told him
one of the things I want you to all note is how Professor Nuttycombe is positioning the arm of our patient today. It's not dangling. She wants to make sure that,
you don't have to manhandle your patient.
Yeah, so notice the cuff is on heart level. So when you come to lab, if your patient's arm is dangling or whatever, that's why our overbed tables are available for you to prop up your patient's arm, just like this. So she's going to demonstrate how to do a brachial pulse pressure.
So
and
his
this
feet
is
are
the
nice.
way we estimate systolic blood pressure, the top number.
So his feet are nice and flat on the floor. I have my the gauge right here, so it's easily visible for me. So what I'm going to do is with his arm kind of rested, it's at heart level. I'm going to palpate the brachial pulse. But I was having a little trouble feeling that pulse again, so I kind of had him straighten and then rotate His arm out. Okay. So once you feel the brachial pulse, what you're going to do is you're going to turn this dial on the bulb that you're going to use to inflate the cuff so it's closed, and I'm going to pump it up. As I pump the cuff up, I'm going to monitor his the pulse. And what I'm going to do is I'm going to note when I no longer feel the pulse anymore. Okay, I'm going to note the number on the cuff. Okay, so I'm pumping the cuff up. I think it was around 120. So now I'm going to slowly, I went up maybe like another 30, and now I'm going to slowly deflate the cuff again. And as the cuff deflates, I'm going to watch my dial and I'm going to feel the cuff, or I'm going to feel the brachial pulse. Sometimes you might see the dial kind of tick a little bit when the pulse comes back. But I'm going to feel for the brachial pulse, and I'm going to watch for a tick on that dial for when the pulse, I'll be able to palpate it again. Okay, and very slowly. All right. Okay. So when I deflated it, I felt the pulse, the brachial pulse, come back around 118, and that's also when I saw the dial tick. Okay. So what I just did is I estimated the patient's systolic blood pressure. Okay, so that's gonna kind of give me an idea of how high I should inflate the cuff. Okay, so if I saw his heart rate come back at 118, that's what I'm estimating his systolic blood pressure to be. So I'm going to add 30 to 118. So when I'm auscultating for the blood pressure, I'm going to pump the cuff up to, what I got, 148.
Yes.
Yeah, I'm gonna pump the cuff up to 148, 150, okay? And that's what I'm expecting when I'm auscultating for the blood pressure. That's what I'm expecting to hear. Okay, his systolic blood pressure to be around 118. And then Diane asked, so you only use your hands, not a stethoscope, to note this. For this method, Dr. Shaver, I feel like I've seen people use a stethoscope before. But I think typically the way we teach it in lab is to palpate
Yeah,
the brachial
we
pulse.
typically teach to palpate it. You will use your stethoscope next is the next step, because now we have an estimation that we think our patient's systolic blood pressure is 118. So just as Professor Nuttycombe said, now when she auscultates the blood pressure, she will pump the cuff up 30 above that, about 148, 150. And then with the stethoscope, she will verify that that is the systolic pressure. So as you're practicing vital signs, you won't hear anything when you first listen with your stethoscope, and as you release that valve, you should start hearing the thump, 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 thump of the heartbeat. So you listen for when you first hear the sound, and then when the sound completely goes away, that is your diastolic pressure. So those are the two numbers we're looking for.
Okay.
Okay.
Is there a specific number that you have to inflate the cuff? When you're estimating the systolic, is that what you're asking, Katie? So when you're estimating the systolic, is there a specific number you have to inflate the cuff up to?
Yeah. Mm-hmm.
So what I typically did is when I was inflating the cuff up, I kind of noted when I stopped feeling the pulse, and then I went up, a little bit from there. Because when I was inflating, the whole time I'm palpating the brachial pulse. So when I was pumping it up, I stopped feeling it around 120. So I went up about 30 from there. And then when I released the pressure again, I just re-verified, I like when the pulse came back and when I saw that tick on my little meter. Okay, which was pretty close. It was 118.
Oh, okay, got it. Thank you.
Does that make sense?
Yeah.
And did I explain that right, Dr. Schaefer?
Yeah.
Yeah.
Yeah. So I know if you've been in a doctor's office, maybe they skip all the checking your brachial pulse pressure. But our job here is to make sure that you do the best technique possible. So we want you to be aware that this is a way to make sure that you are verifying your patient's blood pressure and where to start in a more thoughtful way. So the next step is taking your blood pressure, listening with your stethoscope. So now if our patient was here, then we would, Professor Nuttycombe would pump the cuff up to the estimate of 150-ish, because our patient, we think his blood pressure is 118. And then you're going to be listening for that first sound, and then which is your systolic pressure, and then your diastolic pressure is when the sound goes away. If I could have an idea of where students are with taking blood pressures, I know it was a new skill last week. I would challenge you to the best of your ability, take blood pressures on your peers, on family members, anyone who's willing, because everybody's blood pressure is different and people's anatomy is similar, but it really helps to practice on different individuals. Okay, excellent. Thank you for answering the question. Yes, so the first number is your systolic, is when you hear the first thump, 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 thump. And then when you don't hear any more thumping, that's your diastolic pressure. The other thing is practicing with releasing the air slowly and rhythmically with, one of the things, it's an old saying, but to make sure you got the bulb right, you remember it's righty-tighty, loosey left. So if I'm rolling the little knob right, I'm tightening, making it tight, but if I'm loosening it, I'm pulling it back left. Between getting the estimate systolic pressure and validating the actual blood pressure, do we wait like 5 minutes? There's literature about this, that if you palpate for a systolic blood pressure using a brachial pulse pressure, you only have to wait like a minute. Now, then you can go ahead and pump the cuff up again. Now, if you have a patient whose blood pressure is elevated or low and you're feeling like, I'm not sure if this is accurate, you do need to wait 5 minutes before you retake it to kind of let the patient recalibrate. What are some of the things that can elevate a person's blood pressure? You can type some things in, like
The food they eat.
caffeine, yep.
Stress.
Larger cough, yep. Anxiety, absolutely. Recent activity, yes, all those things. Absolutely. So it is okay if you get a higher reading than you expect to ask your patient, have you had coffee recently? You know, surrounding anxiety, some people have something called white coat syndrome when they see a provider or a nurse comes in to whatever, you come in and take a blood pressure, they can feel a little anxious being in your presence. So usually I try to, if it's high, I'll just chat with them a little bit and say, I'm going to recheck that in about 5 minutes. And then I try to let them sit quietly and see if it is indeed high or they're just, they're feeling a little nervous. All right. That is blood pressure. I want to reinforce, here, let's just do a little practice because you're learning how to read blood pressures. So for this first one you see, what is the reading? And what is the systolic pressure for the first one? Am I sharing this or
No,
no?
you're not. I was gonna tell you, you're not sharing your screen.
I was thinking, I can see it, but no one else can. Okay, hold on. Hang with me. We're getting to the, okay. Hanging so well. Now, can you see it?
Nope, not yet.
Not yet. Okay. Okay, talk amongst yourself while I figure this out. Hang in there, everybody. We're getting there.
There we go. We can see it now.
Awesome. Okay. So I think what we'll do is if you have a scratch piece of paper, why don't you write down what you think the answers are to all four of these, and then I'll show you the answers, and then we'll review, okay? I'll give you, you can always use the notes feature on your phone if you don't have any paper near you. And I will say these are all elevated blood pressures. I think they all, let's see. Oh, except for one. Okay. So one of the things you have to recognize is this would be the systolic pressure, and this would be the diastolic pressure. And then you have to get used to reading the little lines on your meters. So you can go ahead and look at your own meter on here. So what you'll recognize is this is 20. And then the longest line between 20 and 40 is obviously 30. And then you have to go up by twos. So what is this patient's systolic and diastolic pressure? What did somebody get?
166 by 44.
So it's one, yes. So you can see how our peer got 166 over 44. Here's the 40, counting by twos, 42, 44, and then 160, 162, 164, 166. Okay, does that make sense to everybody? So then we'll move on to the next one. What was the next reading?
140.
140/86.
You got it. That's right. And then the next one, this patient I'm a little concerned about. What's our blood pressure here?
216 over 110.
Yeah. So this person, if you're the nurse taking this blood pressure, what would you do?
Wait a minute or 5 minutes and retake it.
Yeah, and I probably ask a few more curious questions. Are you having any other symptoms, right? Because you could have a blood pressure cuff that's really off the charts. You know, you got to make sure that's another little tip. When you're using your blood pressure cuffs, remember the needle at rest needs to sit in that little circle. So when you're looking at your cuffs, the needle at rest, and look at that little donut. Okay, thank you, Jesse. If it's off to the right or left, that means that it's not calibrated. All right. So yes, I would retake it, but I'd probably start asking some follow-up questions. Okay, now what's this patient's systolic and diastolic pressure?
I said 136 over 88, but I don't know.
Yeah, you're right on it, right? Look at that. You got it. Okay, so that's how you read. Everyone knows how to read the meter. All right. Well, what else is on here?
But Professor,
Oh, yeah.
our blood pressure machine, it's like there's only one indicator. It's not two for the systolic and diastolic.
Oh, so thank you for saying that's a very good question. Because you will only have one needle on your actual blood pressure cuff because you're going to watch the needle at 2 points. For demonstration purposes, we created those little dials that are showing the one needle but at two different points, if that makes sense. So when you pump up your cuff with your one needle, you're going to hear the systolic pressure and you're going to notice, here, let me go back a slide. So you're taking your patient's blood pressure. There's only one needle at a time. This one would not be there. you would pump up your blood pressure cuff and it would start going down with letting the air out. And then you notice the first sign, your first heartbeat, beep, it'll go bump, 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 and then go away at this point at 86. So your needle, you're looking at it at 2 points. You're looking at it this point and this point, but it's the same needle. Does that make sense?
Yes, it makes sense.
Yeah, it was a good question. Yeah, because these look like clocks more than your meters. Yeah. All right. We're going to chat a little more about vital signs. This is just a reminder to all of you. Remember that we're going to do our first sim day after your lab next week. We are not in building 4, we're in building 3, and I will post that as soon as we stop here. I'll put the room you're going to be in. What we're going to do is we're going to split labs. So I'll take 2 sections and Professor Nuttycombe will take 2 sections, and we're going to walk you through your first virtual patient. You still will come for lab, okay? We got a lot to cover still. Okay, just another refresher about your thermometers. These are the ones you're going to use for validation. One of the things I want to point out to you is if you forget how close to hold it to the patient's forehead, it's right on the side of here. Okay, it's for, what is it here? That's changing the mode. It'll say it's a non-contact thermometer and you hold it 3 to 5 centimeters away from your patient's forehead. So these do not touch the forehead, but they are, so if you don't know what 3 to 5 centimeters looks like, make sure you're looking on a yardstick or something so you're clear. But it's very close. And you just point and push the button and it gives you a reading. Okay? These will be out in lab for you to practice with. And the last thing I want to go over is I know we are a little limited with taking vital signs complete set because you don't have a thermometer at home and you may not have an arm that you can take it on with a family member or peer or whatever. However, let's review how to take a pulse and respirations accurately, okay? Everyone can find their own radial pulse, right? And so you can start, I'm going to put a timer on my phone. So what I want to do is, I'm hoping, let me see if you can see me a little better. We're going to start by taking our own radial pulses. And the way we do this is we are going to feel for our radial pulse. And when I say start, you're going to count how many beats you feel for a full 30 seconds. Now, we report and we put in the electronic medical record a minute, not 30 seconds. So if my pulse is 32 beats per minute in 30 seconds, what do I chart on my patient? How many beats per minute? Thank you. 64. So you're feeling for 30 seconds, but you're charting a full minute. Now, if during those 30 seconds I had a strange feeling pulse, like it wasn't regular, it was thready, it just didn't feel right, I would count it for the full minute. But my pulse is feeling regular and the rate seems okay. So we're going to start by feeling your radial pulse for 30 seconds. And then you're going to count your own respirations, which is a little weird. It's hard to do. But what I want you to do is, if it's comfortable for you, you can move your arm across your chest and it helps you count the respirations a little bit. You do not tell your patients, hey, I'm going to count your respirations, because they will breathe a little strangely. They're not going to be a normal rate. You don't have to use this technique if you're more comfortable keeping the keeping the arm down and just watching the chest rise and fall. That's fine. Either technique is okay. So is everyone ready? You find your radial pulse. What I'm going to do is you're going to feel it for 30 seconds. Keep that number in your head. You're going to start counting respirations at the next 30 seconds and keep that number in your head. Okay? So let's start. Okay. I'm going to remember that number, and now I'm going to start counting respirations for the last 30 seconds. Well, that's telling us it's over. Okay, so that's the way you do this. So for my pulse, I felt 30 beats for those 30 seconds. So my pulse is 60. And then for 30 seconds of respirations, I was at 8. So I'm going to double that. So my respirations were 16 and my pulse was 60. So what can we, does anyone need a clarification? What are your thoughts?
So like respiration, is it like the amount we breathe out?
A thank you. Yes, the full respiration is one breath in and out. Yes. So that's one rep. The reason you may and this takes practice, and that's why we want you to have watches with second hands. You need that sweeping hand to count for a minute. We do have wall clocks in the lab, but when you go to clinical, you're going to need that second hand. We do not let you use Apple Watches because those have data in them that we can't allow you to go into a clinical or testing center with them. So please get a very inexpensive watch with a second hand that moves around. But that is the rhythm. So typically when I take vital signs, I start with a temperature. And for me, I like to move to pulse, respirations, take a blood pressure. And then I usually will ask, are they having any pain that day? Remember last week when we went through the slide deck that pain is the 5th vital sign. You could have asked about pain earlier in your assessment because pain can affect blood pressure. But that is the way I do it. I go to temp, pulse, respirations, blood pressure, and then pain. Okay. It does need some practice. We're here to reinforce your learning about it. I know pulse and respirations are pretty quick to get. When you're counting them, see if it correlates with the way your peer or yourself is presenting, because if somebody just ran up a flight of stairs and the respiratory rate is 22, does that make sense? It's a little higher than normal. Yeah. Yeah, so when we take vital signs, we definitely think about them. We just don't write them down. We see if it makes sense. All right. All right, that was a lot, right? How is everyone feeling?
Good. It just needs a lot of practice.
Yes.
I feel good
Well,
about it.
here's the good news. We will ask you because remember we're preparing for you to do a full head-to-toe assessment, a medication administration, and vital signs. We're going to take vital signs every week for multiple weeks until like week 8, okay? Because we want you to find a peer, take a vital sign, and make sure you feel super, super proficient. So this isn't a, we just taught you this today, and we're never going to talk about it again. You will use hand hygiene every single lab, and you will take vital signs on a peer every lab as well. And you will chart. Next week, you'll chart your peer's vital signs. So all of these are building blocks. You're going to continue to ask your faculty for, hey, am I doing this right? And they will definitely be there to give you the feedback because we are very invested in your success and for you to feel comfortable in performing your skills. Okay.
Professor, I just want to ask. So the respiration is when the person takes like there's one.
Yes, that's
Okay.
one. Yes, it's a very good question. Yeah. Next week, our mannequins are gonna be turned on and I think everybody has a mannequin in their lab that the chest goes up and down. So you'll be able to count them that way and practice what feels good to you about counting respirations. If it's keeping, holding on to the radial pulse and just subtly watching the chest rise, or you like to move the arm across the chest so you can see it rise that way. So you can practice those techniques and see what you feel comfortable with. Oh, I want to review stethoscope too before you go. Everyone, what is the appropriate way to place a stethoscope in your ears? How are the little headpieces pointing?
Like in nose piece.
Yes. So one of the things it looks, if this is a very inexpensive stethoscope, my good ones in my office. They should point like a nose. They point out. So they should point out and then you set them in your ears. Okay. Now let's review the larger part of your stethoscope is the diaphragm. So right now it's hooked to the diaphragm. When I tap it, I can hear it very loudly. And then if I twist my stethoscope right here, now, when I tap the bell side, the skinnier little side, I hear it louder. Okay? So it's very important for you to get familiar with when you use the diaphragm side or the bell. That'll become for weeks to come in the coming weeks. We will suggest that you listen with one side or the other depending on what we're doing. Absolutely. I love the fact you're trying to listen to your own heartbeat, which is great. That's a good way to start finding how to listen to heart sounds. On your PowerPoint from last week, there is a slide that has your the chest on it, and it shows you the areas we listen on the heart. Go ahead and look at that slide. Go into the bathroom just privately and find the landmarks on yourself. You start by finding your clavicles. Everyone, your clavicles. You're in the middle of your clavicle. You're going to go down on the right side of the body to the second intercostal space. And an intercostal space, you'll remember, is you feel a rib, you feel a little dip, that's an intercostal. Feel another rib, and then you feel a dip. And that's the place you can listen to your aortic valve, opening and closing. So that's a good place to start. If you're going to practice taking vital signs, you can do your radial pulse, you can listen to your heartbeat. There's another pulse I'd like you to try listening to, another heart sound. It's called at the apical pulse. It's on the left side of your body, kind of under your nipples. So you're going to do the same mid-clavicular line, and you're going to go down kind of midpoint right under your nipple. That is you'll hear a loud heart sound there. Again, we're going to practice this in the coming weeks, but this will help you continue to put pieces together. Use your own, neighbors, maybe not neighbors, peers. Anyone will let you to take their blood pressure and then find the landmarks on yourself. It really will help you translate it when you have your first human patient in front of you. You'll be like, oh, I know where these things are. We expect you and your patients, your standardized patient, expect you to touch them to find landmarks. That is totally okay. Okay? All right. So, a quick tip. Okay. Excellent. I love when you're helping each other. That's great. Okay. Um, okay. I'd like to give you the rest of the time here to, if we could help answer any curious question or reinforce anything that you learned today. If you'd like to jump off and take lunch, that's fine. Please remember to do your PPE activity and go react so we can give you some feedback. Um, I think, what did I say? Until Saturday? It'll help the lab faculty and myself give us time to look at your video and give you feedback. So I think Saturday will work. And is there, oh, Faith, what can I do for you?
Rose, is there gonna be an open lab tomorrow?
That's a good question. To be transparent, we're because the second semester students couldn't come in and do some skills, we're doing some extra things for them. They only come in for 2 weeks. Professor Nuttycombe, do you know if we're having open lab?
It was scheduled.
Yeah.
I'm happy to be there if I'm not needed.
Okay.
For 359. God willing, school's
I think they're
open.
covered. Okay. So yes, go if you're signing up for open lab tomorrow, and I'll try to help as well. So yeah, we'll have it. Now, what room will we be in? 318, do you
I
think?
think it's 318.
Yeah,
Yeah, up on the
yeah,
third floor.
open lab is going to be in different rooms throughout the building because of just things that were going on, but we plan to have it in room 318 in building 1 on the 3rd floor. And I think it starts at 10. No, oh, it starts at 1
At
tomorrow.
1, yeah.
Yeah, yeah.
Dr. Schaefer, Katie
Mhm.
asked, do you want them to submit vital signs for week 2 in DocuCare, since some students were having trouble logging in? Maybe let us troubleshoot those issues and
Yeah, I'd rather troubleshoot, and we will definitely document a peer's vital signs next week. So finding where you need to do it is fine for this week. We'll build on it next week. I also want to open it up to the other faculty here. Is there anything you'd like to reinforce with the students that I perhaps missed or misspoke, or is there anything you want to add? Go ahead,
I'd like
Kelly.
to
I'd
add a
love to
couple
hear. Yeah,
things.
yeah.
So I took some notes throughout. I just want to say you all can do this. And our inherent intuition is to help others. But a large component of that PPE is to protect ourselves so that we can help as many people as possible. And so, really, just getting in the habit of associating the diagnosis with the category of PPE needed and then the materials included not only reinforces what you need, but in the future, when you're super busy and overwhelmed and you want to rush in and help that person, you can quickly know what you need and help them faster while still protecting yourself. Um, the sterility part too, sometimes other people will ask us, hey, can you grab me this and put it on my field? Absolutely. Staying really in the habit of the 1 inch border, being aware of your surroundings. You're going to all go into rooms you've never been in before. Sometimes there are sterile fields set up in those rooms. And so if you're moving a patient or moving around, just really being aware of your surroundings. You don't want to mess up somebody else's sterile field, even accidentally. Um, Taking the time, even when you're at home, to just hold your hands like this also is the most important thing, I think, of really keeping that sterility. Again, when you are really busy and there's so much commotion around you, you have to really stay true to your sterility. You know, nurses are the most trusted profession. That's a huge part of our integrity, um, is staying true to that sterility. It goes back to that intuition of helping somebody. Goodness. Practicing measuring, right, invites more opportunities for just things to go wrong, things not to be found, things to be dropped on the floor, and really just thinking through that or writing it down to ask, what do I do if this falls on the floor? What do I do if I turn my back and there's somebody there and I trust that person? But talking through that, I think, just is really helpful. Um, if you have 5 minutes, that's awesome. And you have no one to practice with, there is still so much that you truly can practice. All of these maneuvers are brand new. And even just looking at the second hand, and just so you're not thinking when you are also trying to count, when do I stop counting? Just getting that motion is really helpful. Like, oh, if I start on the two, where do I stop? And then you're not taking all that extra time of counting the second hand while you're like, it's just a lot to count at once. So that's a really good thing to get in the habit of. And then when you're documenting, like on your piece of paper to go back to the chart, you counted 34, just write 34 times 2 really quickly. You don't have to do the math in the room. You can go back to counting respirations. You can write 8 times 2. And that just really gets you in the habit of not accidentally documenting the wrong number, but also not feeling flustered with doing the math while you're also counting respirations in the second hand all at once. So just write times 2, and you will never forget that you have to multiply it.
Excellent. That was an excellent summary of our time together for sure. Thank you. Thank you so much, Kelly.
Dr. Shaver, I'm so sorry.
Yes,
One
go
more-
ahead. Yeah.
One more
Yeah.
thing, just because a few questions in the chat. So we're not
Mhm.
submitting anything in DocuCare this week. So nothing, no vital signs, nothing for the scavenger hunt, nothing in DocuCare. You do have to do the Go React PPE video, the PPE video for Go React. Dr. Shaver, is there anything for a post-lab reflection this week?
You know, I'm going to pop into Blackboard real quick to see what I wrote there.
Looks like 2 quizzes and I think
Oh yeah. So
reflection.
when I assign a quiz, they are from Lippincott, and they support just kind of reinforcing remembering content. What is this reflection? You know, I'm going to take the reflection. I'll leave that because I would like to hear from the students. Under the Reflect After Lab, the 3-minute reflection really is just a touch with all of us, like what's going well for you and anything that we need to reinforce. It's just to help you. I don't want you to overthink it, but it really just helps you start to say, okay, what did I do today and what do I need to do in the future to keep moving forward? And the quizzes just reinforce technique and answers. And I try to give you those as options periodically because they help you when you take a didactic quiz or exam, you're continually taking practice questions. So those are there for you. If you're looking how to do time management today, I definitely want you to give the Go React thing a trial, and I would like you to do the 3-minute reflection because of our group setting. I just would love to hear from you. How's it going? And if the quizzes you can do, they're there as a very strong suggestion. Okay. But I recognize we're in unusual circumstances today with being online. All right. And I'm going to linger here in case there's, I know Professor Nuttycombe has some students that are having trouble with getting their resources. So she can work with you on making sure you can get on DocuCare. And I wonder if I could just make a little breakout room for you, Jesse.
Yeah, I was gonna ask.
So if you want help with technology or DocuCare, go to breakout room 1. Okay. You can just choose that breakout room. It should be up now, and then Professor Nuttycombe will go to that room and help you out. And I'm happy to linger here if you have any curious questions for me. And I will say I very much enjoyed your time and attention and interaction. I appreciate it. And I'm going to stop the recording now.
Thank you, Professor.